on these areas. Thank you so much for your joining in the session also. I think we thank all the panelists. I think our Malcolm manager has just left the panel since we are one more webinar. So he has conveyed his wishes to our sessions and we have moved out. So we have another two panelists along with our chief guest Y. Rajan sir. Here we have, I think, lots of audience pouring down the questions and yeah, they're giving the appreciation for the session. And few I just wanted to put up here. So one we have that is what are the challenges and opportunities in the development of India from rural level to urban level? So, sir, please provide some key points on education through science, technology, research, and innovation for students and faculty. So, this is one question which we got from viewers. So, I request, I think maybe Vijayaraghavan sir or Pillai sir can take up, or even it's open to our Y.S. Rajan sir also can answer it. Any three of one of them, they can give their views.
I think Rajan sir wants to answer.
Yeah, sure.
Just unmute.
Not answering. I'm not answering it. I've already put it in the chat.
Yeah.
There was a with Abdul Kalam this one. I have given what precisely they are. They have typed it.
Okay.
It is to tell it in 4-5 sentences. The main thing is what he said about the relevance is what the young people and academic institutions should see, not something citation and paper somewhere. If they work out a relevance, they will find solution. And we have to work on immediate needs. Don't say something is going to come on 20, 30 years. You can work. Immediate needs to fill in the ones in the urban areas. Pura is, in some sense, have been subsumed under urban areas because India has developed since 1998. A lot of roads, all those connectivities are there. So, with the urban areas, 2,700, all educational institutions there, and they should concentrate on. I have given it. I will going on listening to all the good talks. I have put these things. And cyber security is one item which needs to be done at a very national level and then done it. It can't be done in each urban area or one of it. That is one item yes, extensively covered. That is very important. That is to be done integrated into the system because digital India will be everywhere. All the 1.36, it may become 1.4 billion. That is it. All of them should be having a smartphone. Let us not think of anything less. So that is necessary. It will become an essential need. So this is what it is. I'm not good.
Yes, sir. Thank you, sir. Okay, sir. Yeah, we have a few more questions. I think one from Irula and Jeffers, retired officer. So he asked, agroforestry must be widely practiced in wasteland area to protect soil, microorganisms, moisture conservation, as well improve the productivity of land and increase the peak hour. The view of
Rajan.
Or we have another question. Okay, that is
agroforestry
yes,
is useful. Maybe if other panelists sometimes want to say they can useful, but that will require quite a bit of changes in law, in the forest laws itself. If you do something, they will say no, you can't cut it. Even if you grow a big side your own compound, you can't cut it with then it will get into the environment. We have got some funny goods like that. All of them have to be taken out, and then these things can happen. Yes, it is a possibility, but just an agroforestry alone is not enough. You have to have the really pulp, making it into something. All those chains have to be done. Then it is very useful. That will also regenerate India because we don't need all the land. What we are having 169 million hectares for giving all these grains, etc. It can be brought down to 125 or less. So many of them can do. That's it. Over.
Okay, sir. Okay, thank you so much. I think we are coming to the conclusion of this session. So thank you so much to the panelists, our Padma Bhushan, Sivadanu Pillai sir and Mailswamy Annadurai sir, also our Vijayaraghavan sir for joining this session. I think it is a wonderful high opening, and all three of you are closely associated with our Kalam sir and want to work how the Vision 2020 can be enabled. Definitely, I think the country needs your support and guidance. Definitely, we'll plan up for the further sessions as well as how to reach out to the ground level. So it's not like only we are going to have a conference or a sit and talk. We need to go for executions. Definitely, we want your guidance and support. We will move forward. So once again, I thank you. And it is a session which is organized by House of Kalam and Abdul Kalam International Foundation on Conference India Beyond Vision 2020 Challenges and Opportunities. So it is a time to get inside the session two, which we have another four eminent panelists. I think it's a very important where we are all discussing about the
One
health
second.
care.
So,
Right? Yeah.
Sir, thank you, Rajan sir and Pillai sir and Vijayaraghvan sir. Thank you so much for your time. Thank you so much. We'll like to work with you continuously. We'll come back with the plans. We also thank Sir. We will start the second session. Thank you, sir.
Okay. Thank you. Thank you.
Thank you.
Thank
Thank
you.
you, sir. Thank you so much. Yes, sir. Yeah. So I think the COVID-19, where we are all facing the huge problem, and that is the more important the healthcare. I think now the doctors, nurses, and the healthcare workers, everybody has become a god to us because they are working 24/7 to protect our nation. It is not only in our nation, it is globally. The Indian doctors are working in US and other nations, and they are making a pride among the people how we can able to get rid of this COVID. Definitely, I think it's not only doctors can also enable the engineers, scientists, and technologists to also involved in bringing up lots of solutions to go against the war of COVID-19. So we have four panelists right now. It's one, I think, Padma Shri Dr. Taraprasad Das. We have he's from LV Prasad Eye Institute, and we have Dr. Amar Prasad Reddy, who is also like advisor for Health Minister of State for Health and Family Welfare. And we have a next speaker, Dr. V. Mohan, who is Indian diabetologist, and he is the founder of Dr. Mohan Diabetes Specialty Amarnath, who is from Apollo Hospital. So we have four eminent speakers, and who is going to discuss about how the India is going to involve the beyond 2020 and the vision of Kalam's or dream, the challenges and opportunities. So let me initiate with the first eminent speaker, Dr. V. Mohan, sir. I think he's the one of the prominent. We are all known about the Dr. Mohan Diabetes Specialist Center, which is all over the world. Also, it is working with the WHO Collaborated Center for all the preventive disease. So let me read his, a small profile about him before we hand over the session. So V. Mohan is an Indian diabetologist. He is the chairman and chief of diabetes Specialty Center, which is a WHO collaborating center for non-communicable disease prevention and control, and an IDF Center of Education and an IDF Center of Excellence in Diabetes Care. He is also the president and director of Madras Diabetes Research Foundation in Chennai, which is an ICMR Center for Advanced Research on Diabetes. Just hand over the session to Dr. Mohan, sir. I think he is going to take up a lead. So please.
Thank you so much, sir, for that kind introduction, the kind words. I was very honored when Brother Sheikh Dawood called me yesterday and asked me to be part of this panel. I was not aware of it, so I had to, in between two sessions, I had to squeeze this in. Thank you so much for accommodating me. When I see the distinguished panel, many of whom are my very good friends, it's very nice to panel with so many distinguished people, many of whom I have known for many, many years and for decades. I would like to first of all congratulate the Dr. Abdul Kalam International Foundation for taking up this initiative, because it's extremely important. I'm sure this would have made Dr. Kalam very to see so many people, because he was all about interdisciplinary, multi-sectoral work, as Dr. Rajan will corroborate what I'm saying. So he always believed that when different specialities come together, that is how the fertilization of new ideas occur. And for a doctor to sit with other scientists, including defense and other in the same forum, itself is something which will bring about revolution. And that is what exactly Dr. Kalam would have wanted to see. I've had personally been very much blessed to have met Dr. Kalam on several occasions. He's visited our institutions. He has been a guide to us. And therefore, a lot of the work which you have done also has been personally blessed by him. I'll go straight into the subject of medical research, because I'm a medical researcher and a physician. So the one question which people often ask me, in fact, I was very surprised, in my alma mater, the second oldest college in India, Madras Medical College, invited me 2 months ago to speak on the subject, can medical research be done in India? And they asked the question, can Madras Medical College ever do medical research? And I said, sir, you should not even ask such a question. I mean, it's an insult to anybody to ask such a question. Can you ask such a question? Can you do it? We should be a leader in research. We should be the world leader. We should be beating China. We should be beating the United States. Today we are emerging as a world nation. So such questions should never be asked. There's no question mark behind all this. We should say how we can become and prove to the world how we should become. If you take medical research in India, India has so many phenotypes and genotypes. The other panelists, the doctors who are with me, my good friend Dr. Das and others will agree that each phenotype is so different, each genotype is so different that for the next 50 years if we work, it won't be sufficient to bring out novel research in India because so much needs to be done. If you take diabetes, there are so many unanswered questions. We always knew that type 2 diabetes can occur 30 years, 20 years younger than in the West. Why? We still don't know. We are researching, we're finding so many things. We have found, for example, that the beta cell function, the pancreas function, goes down very rapidly. If we have, suppose you take 100 Indians who are in the stage of pre-diabetes, and you take 100 white people who have the white man may be much bigger, BMI may be higher, body weight will be higher, but he doesn't progress fast. We thin Indians seem to progress very fast. Within 3 years, they've zoomed across to the stage. Why? What can we do to prevent it? There are many questions like this which begs answers. To study the genomics, you'll find it's different. To study the phenotype, you'll find it's different. To study the biochemistry, you find big difference in Indian being more insulin resistant than a fat American, for example. Why? So many basic science and so many other things need to be done. Take COVID-19. With a population of 1.3666 billion people, what is the number of deaths in India? Of course, it's not single death in India. I'm not belittling that. I'm not going into that. But you take our population. We said there will be 300 million deaths in India. What happened? Nothing happened in India. We have less people with COVID than the number of deaths in the United States. The United States is 3 times smaller than us in population. Why is that? Why is that? Is it genetics? Is it because we have immunity? Is it because the strain is different? Is it because the genotype is different? Is it because the virus is different? Is it because behavior? There are a million answers itself to be found if you start researching. So I'm sure COVID itself will open a big research in researches that we are different. Coming to more practical aspects which Sir Kalam would have liked, he was always for low-cost technology. He was always for Make in India. He was always for the Pura, which was already mentioned. So inspired by many years ago in the village of Chunampet, in about 120 kilometers south of Chennai, we set up, along with the help of the National Agro Foundation, and Dr. Kalam visited that and saw our telemedicine van there. We set up the first telemedicine facility for diabetes, covering 42 villages in and around Chunampet. Not only they provided service there, we built a rural center. All the facilities available in the urban areas, we were able to give in the rural areas. An exact transformation of this Pura in the field of diabetes. What that resulted in is people could get low-cost treatment at their doorstep without traveling to Chennai. And many of them, in fact, people from Pondicherry started going there, saying it is lower cost and it's nearer our place. So this is one example. I'm sure Dr. Das will be able to give you many examples of his LV Prasad, how they are also able to do that. Today, with COVID-19, telemedicine just turned on its head a methodology which is not even legalized. The government of India had said that if you do a telephone consultation, it's a non-bailable offense. You can put in jail. Why? Because somebody in Bombay gave a wrong thing or they heard it wrongly. The patient took the wrong medicine and died. Okay, so telemedicine was actually stopped. Within a week or two of COVID coming in, telemedicine guidelines were introduced. It was made legalized, and thousands of doctors all over India, including me, even now I sit in this very room. This is my library at home, from which I have not moved out for the last 2 months, but I've done hundreds and hundreds of teleconsultations right from here, learning many things in computer which I never even knew. So telemedicine really took off. So I would say COVID-19 actually taught us a lot of things, and Dr. Kalam would have been very happy and proud that such a field actually opened up. And I would say that somebody mentioned about education. This is a very good field for India to teach the world medicine. What is the advantage that India has? We are excellent in computers, our software is good, our computing skills are good, we are the IT capital of the world, our doctors are fabulous, our English is good. Okay? The Chinese can't compete with us in that one thing. They can beat us in many other things. So with this, why can't we become the medical education center, not only for the whole of developing countries, Africa, South America, Asia, and so on, but also for developed countries, because they have to outsource. Do you know that 50% of all the journals in my field are printed in either from US, are printed in Chennai or in Bangalore? They are outsourcing it to us. When Sindhuraj here picks up the phone and he does all the printing for the journal, when you send it to America, it's actually printed here, including Nature magazines and so on. So I think India has got a large role to play. I'd like to talk about low cost. If you take a small insulin pump, it's smaller than this phone, okay? It's about half the size of this phone. Very small thing, I'm sure for engineers it is nothing. It just drives a little needle through, a syringe is driven and it delivers insulin slowly, that's all. You know what is the cost of that? Because it's only monopoly, only one guy producing it from the US company. Minimum cost is 2.5 lakhs. It goes to 5, 6, 7 lakhs. I am sure if Indian engineers come together, we can do it for 20,000 rupees or 30,000. There's nothing in the technology. When I look at it, say, for this, they're charging 2.5 lakhs, 3 lakhs, because that what happens, such a useful technology, type 1 children, every child should be on that, but we are not able to get through it. That is where I think if we sit down together, tell you what you want, you will be able to produce, and then we can then export this, like our Maruti car or like something else that we did, like a nano car. We should be able to do this at very low cost. Let me tell you one other example which Dr. Das also may touch upon it, but my wife is a colleague of Dr. Das and a retina specialist, so we have a lot of interest in diabetic retinopathy. Do you know that a retina camera, good one, used to cost minimum 15 lakhs. It used to go to 25 lakhs. Today, there are at least 2-3 Indian companies which make retinal cameras. It started about 2.5 to 3 lakhs. High quality, excellent. When they came, the Americans and the British said, oh, this will be low quality. It was better quality than others. Show that. Number 2, you're able to get a mobile phone. Okay. And number 3, using intelligence, in about 2-3 seconds, you can know whether retinopathy is present or not. And then you can say whether it has to be referred to an ophthalmologist or not. Okay. Take the picture. You can even take it like a selfie. Just keep it like that. Keep your retinal thing. That is also another camera. It is developing so fast. Here we can produce things at such low cost that we can actually be a world leader. I'm sure the others who are going to talk the same thing. I would say that while it is extremely important to have such forum, as somebody mentioned, follow-up action is more important. If you are able to meet instead of watching this, but say in a room, not in a virtual room, but in an actual room, where we sit down together and write down the country in medical field and get 10 of the top scientists from other fields to come in and say this is what we need. I'm sure India will take leaps and bounds its research field in its technology and thereby reaching out to the poorest of the poor. Today, people are not able to afford it. Today, we have the best of everything, but it's available only for if you are able to make it cheap, if you are make it in India, if you are able to mass produce it, if you are able to test it, if you are able to show that it's not inferior to anything else in the world, I'm sure that India will play a big role. The HCQ or hydroxychloroquine, America did not even know what the drug was because they don't have malaria, they don't have any other disease with which that's treated. We had to supply that to the United States, and the President of the United States saying, can you please supply hydroxychloroquine to us? Why can't they say, can't you supply all the equipments to us? Metformin, the commonest drug used in the United States, all over the world. 50% of the entire metformin that is used in the United States comes from India. This is not an exaggeration. 50% of the entire metformin used in the whole US by every person with diabetes comes from India. So India has a lot of scope in the area of medical research, medical education, in technology, taking these services to the urban areas. Dr. Rajan said that first let us do it in urban areas. Sir, I think the urban-rural divide, as you very well know, is collapsing. No more we have only urban and rural. In Kerala, where is rural today? It is just one continuous urban. There is no rural at all. In Tamil Nadu today, 50 to 70% of Tamil Nadu is urbanized. So very soon, our so-called rural areas will also get urbanized. So whatever we have here today and we are enjoying in the metropolitan cities will soon come to the rest of the country. But we have a huge responsibility with 1.366 billion people, a lot of people still being under the poverty belt. We have a lot to think about, and I think it is leaders like you who can help the country. And I'm sure nothing will please Dr. Abdul Kalam than to see such a forum being formed by eminent people with the people in mind. Dr. Kalam always put the poor man in front. Like Gandhi said, think of the poor man in the street. If it's not going to help him, don't do it. So I think on that particular note, I'd like to end by thanking you all once again, giving me an opportunity to say a few words. And if there are any questions for me, I'll take them. I unfortunately have another program at 5 o'clock. So congratulations once again. I listened to 2 or 3 of the speakers. It was very, very inspiring. I promise you that on my part, I will give you whatever I can to set up such a group and to keep it going in the interest of science in general and India in particular. Thank you.
Yes, sir. Thank you. Thank you so much for your wonderful session, sir. Definitely, I think India is moving forward in the pharmaceutical and medicinal, the emerging trends, what we are seeing in the globally. I think the entire world is looking forward the medicines and tablets to India. That is a big, the vision dream of Kalam sir would have been possibly achieved. Definitely, I think we are going to have this Q&A session at the end of that. If anything is there, I think we can open up right now. Now, sir, we have any questions from?
No. So one question I have myself. So
Yes.
since you said that we can, in terms of manufacturing this stuff. So what is stopping us to go ahead? Because there are some aspects still we are not clear. Okay, our engineers are ready to do prototypes. So 3D prototyping we are ready to do. All these things are possible in India, but something is not moving forward. So what is stopping us?
I think there are good examples of how, first of all, we have to believe in ourselves. So this age-old concept that from the British days we have anything in India, we have been taught like that by the British. Anything Indian must be bad. Any culture is bad, anything is bad, language is bad, everything is bad in India. So whatever we produce in India, we think, oh, it must be bad. Made in India, it must be bad. We are sending rockets to the moon, we are sending rockets to Mars, we are sending, Shivadana Pillai, my good friend is here. We have done so many things here. What for making an insulin pump, you tell me? So I think it is lack of imagination, number one. Number two, lack of trust. And number three, collaboration. Once we come together, I don't think anything can stop us. India is just taking off now. If now it just explodes, I think the elephant will open up and beat the tiger any day. Sir, Professor Rajan, sir. Say you're muted, sir.
The brilliant talk by Dr. Mohan, very good
Thank you,
point.
Dr. Rajan.
I will quickly address why it is not being done.
Yes, sir.
I have been in DST. In fact, Dr. Professor Ramamurthy has posted it. He funded Shanta Biotech, like that, so many are there. In India, there are pernicious, I'm using the word very selectively, administrative rules, which says that if it is developed in India by anybody, whether it is PSU, PSIR, ISRO, or any of them, if it is to be given to a government department, you should have 2 years of export experience. But if you are selling from foreign, they won't ask you. So it is an anti-India type of thing. Unless, but I have put it in this one. I am glad that Prime Minister has thought about self-reliance. If that is told, let me tell you, somebody will come to Professor Mohan. Come on, please tell me. Can you test it and tell? So it is not possible. Anybody who does it, BEL suffer, BHEL suffer, many private fellows suffer. I am going on telling it in every forum. We even put that. That pernicious administrative rules to be taken off. Let them do. Not good, don't take it.
I think I entirely agree with you. And I think one of the things we have to do is every successful person you read anybody's book, any famous man. Dr. Kalam has said this. Allow people to fail. As Albert Einstein said, the only fellow who has not failed was never tried. If you never worked, you never tried, you'll never fail. Any great man, how many times Lincoln failed, how many times Albert Einstein himself failed. So give people and say, doesn't matter if you fail, but you come up with an idea and start executing it. I think that kind of a support if we get from everyone, and I think government, private, today those barriers are all going. So I think all should work together for the collective good of people. There's no more government, private, this, that's all public-private partnership. Airports are built by who? Private people. They're doing it for the government. We have started changing. The roads are built by private people today. So if there is good, if it is a regulated private sector, we should allow them to do it. And I'm sure that I don't want to take up too much of time because it's time for you and for me. But this is a great start, sir. Heartiest congratulations. It's so nice to meet so many distinguished people here. I think we need more time. And if we can, after this COVID is over, maybe a whole day session, brainstorming session, nothing else. Nobody else listens to us. We just sit down together, come up with certain things. Let's invite some more experts from IITs and other places. And I'm sure that India has a very, very, very bright future. And if you just go back to Dr. Kalam's books and the books he's written with Dr. Rajan and go back to that and try to apply each one of that, it's so inspiring. Your hair stands on end when you do that. It is so, so inspiring. Very few people can inspire like Dr. Kalam. And his vision, if you just take it forward itself, is enough. On that note, I'll sign off, thanking all of you for the great opportunity given to me. Thank you very much and God bless.
Thank you.
Yes, sir. Yes, sir. Thank you. Thank you so much, sir. I think you are right. We are getting inside the next speaker. We was Padma Shri Dr. Tara Prasad Das. He is an Indian ophthalmologist who specializes in disease of retina and vitreous membrane. He is currently the vice chairman of LV Prasad Eye Institute. He is a professor of ophthalmology at the Sun Yat-sen University of Medical Science in China. So, can we, Dr. Das, sir, to take up this session? Sir, please proceed.
Thank you so much for the wonderful opportunity. I'm sorry that Dr. Mohan signed up because I enjoyed his talk, and wonderful to see again Dr. Pillai, Dr. Rajan, whom I have known for years. When I saw the picture of Mr. Rajan, I said, it looks like reminds for Rabindranath Tagore. Hopefully he's started writing poems like Tagore and get us Nobel Prize too. All right. But Kalam's vision was always to, like Gandhi told, how does it help a poor man, how does it help a person in a village, how do we have a last mile connectivity. And this connectivity not only in education, in supply chain, in technology, etc. We have been fortunate that I worked only in 2 organizations in my life. My 40th year in ophthalmology and 10 years in Arvind Eye Hospital, Madurai and the group, and then 30 years, including this year in ABDUL. Both of the organizations are the same philosophy, but Kalam was always talking that how to reach the poor, make it affordable, make it available, and make it accessible. Because just available not enough, it's permanent to access it. How to reach the last mile, reach the unreached, underprivileged, tribal, and who can't afford otherwise. Because like Dr. Mohan just now told about the telemedicine, similarly, what will happen in future because of this COVID-19 will certainly go away. 3 months, 6 months will go away, but then will throw certain challenges. I'll confine to ophthalmology only. In ophthalmology, one unique thing has happened for last maybe 50 years is that mass screening and mass surgery. Years ago, we published an important paper from APJAKIF that mass surgery in one place improvised school building or a chowdhury converted to a temporary surgical suite is not good because infection rate is high. This is why the whole system changed, the government of India changed to bring it to operate in a hospital but can screen somewhere else. Because of social distancing, a norm will continue. Hospital will more and more will have to be less crowded. So most probably government like they legalize teleconsultation, they will delegalize the mass screening, which means that people have to go nearer to people, either through their primary care system or through PSC, CSC or variant of that. APJAKIF created a system called Eye Health Pyramid, which is a 5-tier system. The bottom one is for a community, for today, Government of India talks about the health and wellness clinic, followed by primary, secondary, tertiary, and super tertiary or center of excellence kind of thing. Then a populous country like India requires the five structures. Model has been copied by various countries in Africa, Latin America, including Australia. In October 2019, on the eve of World Sight Day, took 2 years to document called World Reporting Vision because Vision 2020 is ending in 2020 and how to do it till 2030 or 2040 and bring down the value of the Sustainable Development Goal. They come out with a new term which is called people-centric eye care, where it says that the eye care should be available, accessible, affordable without a financial crisis. Because of this COVID-19 and what will happen in future, I envisage that go nearer to people, not through a mass clinic, but with fixed facilities. I'm happy that we at Prasad got 184 vision centers serving a population of 50,000 people. Similarly, to my own last estimate, Arvind has got some 70 plus. Then Chitrakoot in Madhya Pradesh, then Srab Charity in Uttar Pradesh, in Delhi, NCR, and similarly a number of vision centers. The Government of India has also got many CSCs and PSCs in all the 700 plus districts. All this can be converted to a vision center and where delivered. Part of eye care is that 75% is avoidable or requires a minimal intervention with the highest return for investment. Example is 46% of the eye care is only a pair of glasses. My own glasses have become kind of blind for near vision. And 29% is because of cataract. 75% care can be given to a person within 25-30 kilometer radius of instead of traveling for long distance. Unfortunately, I'm inducted and I'm actually work with the chairman for the Universal Eye Health Program in Government of Orissa. I partly employed the government. Salary from them, but I get other benefits like my car, my secretariat, my secretary office, etc. Where last year we converted 53 CSCs, community health centers, into the vision centers, and similarly for unreachable districts where population is less, particularly those 60 so 10 mobile vehicles where you can go and reach 1 day per week, that means 50 per time you can go in those 10 vehicles. And this year supposed to put another 50, but then because of this COVID thing I delayed, most probably it will be done again, but we delayed though. What the new normal will happen is that those people who have got a fixed facility close to the people who have the leave will have a much better benefit than otherwise. And we're happy that both my dear organizations close to my heart, Arvind and Sada, are doing that, and we are the leaders. Which ophthalmology taught to healthcare in India is how did we improve our cataract surgical rate. Incidentally, cataract surgical rate called CSR, not corporate social responsibility, is a surrogate measure of how eye care is doing in the world or the country. 1990s, early 1990s, our cataract surgical rate very, very low, less than 2,000 people. And at that time, we got a wonderful World Bank loan. So while we could have done only eye camps, like many countries would imagine, our planners did a wonderful thing called training the trainers and trainees. That helped to improve the capacity building for the country to improve the delivery system. Along with that, which many speakers, Dr. Rajan, Dr. Pillai have already alluded to, this happened. One is that Indian device industry in ophthalmology, let's say intraocular lenses or slit lamps or like this, and the Indian pharma industry making those pharmaceutical eye drops and joint hands. So combination of the Indian pharma, Indian device in ophthalmology, and Indian ophthalmology trained people join hands together today. But average 6,000 plus cataract surgical rate per million population, and state like Gujarat at 9,000 plus actually, way above what any other country in the Southeast Asia do. Incidentally, also the regional chair for the Southeast Asia International Agency Prevention of Blindness, so have the opportunity to look at those 10 countries around us. Let's compare Nepal, Bangladesh, Sri Lanka, Maldives, etc. We are way ahead. In Maldives, 48% of the people today, actually survey published last year, 48% of people go outside the country for cataract surgery. And many of them come to Madurai, come to Trivandrum, or come to Sri Lanka or Bangkok. One argument which government gives, so the people give there, they go for little fun also, because certain funds cannot have in Maldives, but that is not really true. They go for the reason that they do not have the capacity to serve people. There are only 8 ophthalmologists in Maldives, and 4 of them are from outside the country. Same thing applies to Bhutan, in Bangladesh, in Timor-Leste, in Indonesia, except for Thailand. Most probably, most countries are way behind our eye care system. But what is preventing us to become the world leader is one thing we've spoken again and again is that we do not trust ourselves. I was about to say why Indian industry are not flourishing as industry outside. Actually, my answer already gave me Dr. Rajan that yes, I know my friends who are entrepreneurs and industrially, they're not able to go because the government of India will put a ban if it is not so-called imported from outside. In 1980s, when Arvind started intraocular manufacturing scale to meet the both internal need, not only electron, they went to external need. My question, I used to work there, so my question to ask will be imported. I used to joke, I'll import Uganda. Uganda, America said, oh, you don't know Uganda? This is a part of United States of America. Oh, when they say America, they're happy. Somehow you do not believe that if India is not good. I agree that Indian marketing is not good, Indian packaging is not good. The same product made in China is packaged much better than what India does packages. And I know many industries who are making wonderful things and we are buying them. Intraocular lenses or dependence on the import lenses is tremendously reduced. I'm sure in future things will happen. And same thing in pharma industry also. The opportunity to run the entire IL system of Western Africa, small little country in Liberia. When we went to Liberia, we found that drugs were almost 10 times more expensive than marketed in India. And it's not possible to do the bureaucratic stumbling blocks like happens in India too. So that things will open up. This is an opportunity. Winston Churchill many years ago told that a good man will not let go a good crisis. And this is a good crisis. A good crisis will teach us many things how to do it. I was not very fond of example the Zoom technology of I say in-person meeting is always better than meeting distance, but then putting right now I'm doing. In fact, I have got one more after this. After this meeting, I'll do one more international meeting. So things will change, but things will change only when we put our heart, like Kalam always told, that how do we go to the last mile to the tribals, on these people. My heart breaks actually when I see these migrants walking on the street and the road. I'm little sorry that I'm not able to do anything for them, but this will happen. What he is holding is what will require is to do a huge increase into the huge training capacity. Is good, but giving fish is not good. So to train more number of people and not be very selfish that they must work with us, then you can do well. We train a lot of school graduates soon after their schooling for a 2-year program for allied ophthalmic sciences in ophthalmic nursing, in vision technician, where they do a job which is repetitive, doesn't require a huge intelligence, but repetitive. Unfortunately, Government of India stops it, and unfortunately, the BSc Optometry Science people, example, Optometry Council of India, Optometry Federation of India, they put a stop that no. My question to these guys is that who will go to the small villages to work if you are already BSc, MSc qualified? You will not go, but then giving a PRF class in a small village is very simple idea because you can use technology today much better than what is before. A paper published 2 years ago shows that a simple PRF class given to a tea worker, tea leaf picking person in Assam garden has improved productivity by 40%. And similarly, if you give a affordable glass or a free PRF glass or fresh PRF, it will not it's not happening. And what is the fact? Fact is that 1.1 billion people in the world who require a simple presbyopia glass. Aging and the longevity is increased, well taken pride, but then we also become blind at the age of 40, 45 unless we have a near vision reading glasses. So with this thought, I will say that I will echo what Dr. Mohan told that supposing this part expanded beyond COVID or during COVID to a larger platform, and this idea Sheikh Dawood and Salim who called me, I said immediately, I had another finance meeting with I said, no, I'm not finance meeting today, let me go to this wonderful meeting. I want to meet all my friends to this Zoom. And translator, just as Mohan told, just sit down and talk to each other. That might disseminate ideas, and I'm sure that like Honorable Prime Minister told 2 days ago about our self-sustained India, which was not a new idea because this has been told to Gandhi. Gandhi told that do not send cotton to get your finished product. British told that if you make steel, I will buy it. But Ratan Tata went and built a steel. And then this story came from Kalam, and I am very fond of this story because I remind myself a lot of times. And this story, all of you know, but I will repeat. And JRD Tata, they were traveling together from Tokyo to Chicago, one for a religious meeting, one to hire or buy or inherit technology of making steel. For that, I could make some steel. At that time, I believe Vivekananda told that, well, you can survive today, but tomorrow you have to depend on yourself to make something to capacity building and training. That's how the Institute of Science came. Similar way, unless you train more young people and not for employment, but also empowerment, then only our health industry, healthcare, including eye care, can improve a lot. Yeah, thank you. Well,
yes, thank you. Sir, I think very informative sessions about the Kalam dream as well as how we have aligned with Kalam sir and brought so many changes. Thank you for your session and also joining for the session. We have the third speaker who's from healthcare management is Dr. Raja Amarnath, who is a MD, GM, FCCP from Apollo Hospital. He is also like managing director for CAPCA and senior consultant at Apollo Hospital, Chennai. And he is a professor and head of Department of Pulmonary Medicine, Sri Balaji Medical College and Hospital, Chennai. And I think currently Dr. Raja Amarnath is seriously working with COVID patients. We heard about more about him. So thank you, Doctor, for joining this conference. This India Beyond Vision 2020, the challenges and opportunity, which is connecting by House of Kalam Rameswaram. So I just hand over the question to Dr. Raja Amarnath. Doctor, please go ahead.
First of all, I must thank you all for giving me this opportunity. Actually, I did not know when I joined this that, it was based on Dr. APJ Kalam's dream that, the theme of this is that. I think this is some other COVID related talk. In a way, this, whatever is happening right now, extremely close to my heart. I am one of the ardent fans of APJ Kalam. In one way, we are also doing something the other two previous speakers have told, whatever the innovation it happens, whatever is the field, is called a noble innovation only when it reaches the final person, final man, final beneficiary. As far as we are concerned in India, probably the final beneficiaries are people. Pulmonologist, my critical care, DM in critical care. I've been to UK for training. I am basically from a middle class background. All my studies in government colleges. Worked in the government hospitals, wards and ICUs. Also seen the other dimension where this level of ICU care, paperless ICUs, that's what they do. So once I came back to India, working as a consultant in a very big reputed hospital, I don't want to name it. Incident changed my life, which connected us, the team of doctors to Dr. APJ Kalam's dream. Family came from Assam. Wife and had some tuberculosis infection in his brain. Come to Chennai seeking a higher level of medical care. Problem. TB, tuberculosis is something which can be treated anywhere. No better ICUs over there. Believing that Chennai care is the best care available. Yeah, they had come to Chennai for that care. ICU consultant then, and I used to daily see that patient. I used to counsel the wife. The husband was in mid-30s. This lady would be in mid-20s or maybe 30. As I was counseling her about her husband's condition, fainted. Happened in ICU, so we had to rush and then do some basic care for her, and it was nothing to worry. Only thing was she felt very weak. Asked the reason that she had not eaten for 3 days. Reason was come with a budget of some lakhs, few lakhs for the treatment. It got over. Trying to get arrange some money from her native place, which at whatever the money she had, she already paid to the hospital, believing that things that were required for her husband in that care was more important than her own food and whatever the stay. One thing which has shaken my heart. Some of our friends who had who were all like-minded people started off something called as Sipaka. That's what the person who introduced this, he said CIPACA, which actually is a full form of our organization called Chennai Interventional Pulmonology and Critical Care Associates. Organization meant to uplift rural critical care services. Doctors, nurses, and patient counselors, technicians, all are well trained in critical care. Ourselves, we embark on training people, especially on rural critical care. Critical care or ICU care in India, like 5-star hotel kind of service. Get an ICU service for less than 30,000-40,000 rupees a day. We wanted to see whether we can cut it down and make it feasible, economical, and available at the doorstep of people. To the rural areas, what is going on currently is that if any taluk area or a rural area, if somebody gets a snake bite, or a electric shock, or even some small trauma, or even a chest pain, a nearby place, nearby even a district headquarters for a decent ICU care, period required to travel is at least 1 to 2 hours time. 1 hour is something that they lose. People, they suffer. Even though there are no deaths, the problem is they have to be transported there. When you lose the golden time, the situation becomes worsened. That puts on pressure on the patient for requirement of ICU care for even 1 week to 10 days more. It's a financial burden, emotional burden, health-related burden, everything together. That is when we started off doing an innovative model of making shop-in-shop model of ICU services, wherein in other hospitals you take the place and then you run emergency and ICU services just by giving them manpower and required equipment. Okay. You don't require a large time to build an ICU, but it's a plug-in model. Something like, you go to a mall and then you start your shopping inside. By that, because the establishment cost is low, we started off giving ICU care for people for less than 10,000 rupees a day. When the question comes how it is related to Dr. Kalam's heart is that one, reach out to villagers, rural people at their own doorstep. You could cut down the time required for initiating the care, and most importantly, because there are no specialists available in those places, it was to get everybody online. Connected people through telemedicine and tele-ICU services, wherein there is a round-the-clock supervision by the doctors, the specialists from cities who will be looking after those patients in a round-the-clock manner and giving the service, giving the advice to the on-site trained medical personnel. That is how you can match the care that is available in Chennai areas, Chennai hospitals, also available in rural places. Running around setups like that, which holds more than 250 exclusive ICU and emergency beds. Most from rural areas on time basis and getting their lives saved. Third thing is based on Dr. APJ Kalam's dream, where we connect in two areas. In the technology by means of connecting through tele-ICU care, asking people around India at whatever the time they are available, they can log in and then look into the patient's details and then give their opinion, share their consultation, and also making something feasible, economically feasible, and then available at the doorstep of rural areas. In this COVID crisis, every other hospital in those areas was shut down because the government norms was that outpatient services and elective surgeries and general ward admissions have been shut down in the last 45 days. It is the only ICU services that are available in those places for emergencies, problems were these ICUs. Previous speakers told, extremely important, government organizations, especially the bureaucrats, to such innovations where and all it is possible to connect the technological advancements that of any innovation that can things economically affordable and reachable to the, as I said before, the final step of the beneficiary. All such projects are close to Dr. APJ Kalam's heart, and we are all his ardent followers, fans. Whether he is available, whether he is there in his physical body or not, just and his teachings, guidance, in guiding all of us, inspiring us on an everyday basis, and they have been guiding us. I am happy to be part of this webinar and to share whatever the small efforts that we have been doing, footsteps of Dr. APJ Kalam, and I thank you all for giving me this opportunity. I will be happy to answer if there are any queries.
Doctor, I have a question. This is Sheikh, Professor Kalam. This is related to COVID-19. So, we keep hearing from media and the news briefings that there are cases there is no symptoms, but they are called positive. What does that mean?
When somebody gets a doubt that he is exposed to COVID, a COVID patient, okay, and you go and get yourself checked, and the virus becomes positive in your throat, that is COVID positive. But the patient, the person is not yet a patient. The person need not have any symptoms at all. no fever, maybe a mild cough or sore throat, but no fever, no breathing difficulty, no loose motions, nothing. Patient is absolutely fine. So that is when you call them asymptomatic COVID carriers. That is the word used. They are asymptomatic, but they carry COVID. These are the extremely dangerous people for the community. They may be good. Community, they are dangerous. These are there are no symptoms for them going around, and they will be spreading the disease. It is very important to quarantine them for a period of 2 to 3 weeks. Welcome.
Thank you so much, Doctor.
One question from here. One question from here.
Proceed.
One question. Yeah. If a COVID patient survives, is he going to have any permanent damage on his organ or any part of the body?
Any more questions? You are right. Possibility of organ damage only if the patient suffers a terminal respiratory problem. COVID, when it enters the throat, might go into the lungs. A so-called pneumonia in the lungs. Further proceeding into, there is a word called severe acute respiratory distress syndrome. That is what is called as SARS. Call this virus as SARS-2 virus. Final damage that this virus can do to the body. It develops that. Such patients land upon ventilator. Patients, even after they recover, they might have some structural damage to the lungs. Some of them they recover fully, but some of them might have some residual structural damage to their lungs. It is a possibility. Whereas the patient is asymptomatic, only sore throat or a fever is there, never requires oxygen or admission into the hospital, and never requires ventilator. These patients, we can take it granted that they are the danger, out of the problem, and there is no residual organ damage to them. Uses have developed antibodies. Who recovers from COVID infection developed antibodies. Risk of further COVID.
Okay, thank you very much, sir.
The doctors, I think, there's one
Your voice is breaking, Google.
Yeah. Can you hear me?
Yeah.
So there is a medical school and
No, still breaking.
I am unable to hear the question.
Google is still breaking.
Okay. The speakers can hear me. Okay.
கூகுள் உங்களுடைய நெட் ப்ராப்ளமா இருக்கு நினைக்கிறேன். வீடியோ கட் பண்ணிட்டு பேசுறது கரெக்டா இருக்கும்.
Okay, so we will.
Yes,
yeah. Go ahead.
Okay. Yeah. So thank you so much for all the doctors from Dr. Das and Dr. Amarnath and Dr. Chapan. I think Kalam sir said the doctors should have two parts. One is their own physical and another is signing up. So definitely, I think we should salute all the doctors. We have the next speaker. I think he's not a doctor, but he's and he's Dr. Ramaprasad Reddy. And as an engineer, I think he's an media advisor to Union Health Minister, State for Health and Family Welfare. Also, Vice Chairman for National Cyber Security Standard and Chairman for Youth Development Welfare. So I think so as an engineer, as an advisor to the Minister, so we invite us
Sir. Good evening to one and all present here. Nice to see Daud brother and other eminent panelists, Vice Rajanji, Mailswamy Annaduraji, and Sivadana Pillaji, and my friend, my brother Gokul, and Dr. Raja Amarnath, very close friend to me, and whatever he is doing is something tremendous. And every day I see his updates. Being in his COVID situation, he wears the entire PPE and goes into the Apollo block. All these pictures I used to see. He's doing really wonderful. First of all, I think we all should accept that the Honorable Prime Minister of India is doing a tremendous job. Government of India and Ministry of Health and Family Welfare have done extensive and all possible ways to contain this disease. You can see that the curve is also getting flattened, and people are.
Can you hear me?
Yes, sir.
So, lot of opportunities are there. In fact, I would like to answer two things which have been raised by our earlier speakers. One is, I think somebody was told that no, you need 2 years of experience to sell your product for the government or whatever it is, something. But in this COVID crisis, the government haven't done all those things. It has actually leveraged most of the rules and regulations. For example, you have the certification, you have the manufacturing capacity, you can supply to the government. But basically, the certification is very important because standards need to be maintained. Yesterday, I have seen a letter to HLL. USA have wrote a letter to our PSU, to Ministry of Health and Family Welfare, to supply N95 masks. The first time it's happening actually. We should appreciate the government. And earlier, just 50 days before, if you see the PPE manufacturers in India, very few, but they could able to supply only 25,000, 30,000 products altogether. Means all manufacturers together, they can supply only 35,000 a day. But now today you can see more than 2 to 2.5 lakh PPEs are manufactured in India, and in fact, soon we will be completing the requirement in India, and we are going to export for the other countries on a friendly request to them. I think that will be open soon. But the other things like masks, nitrogen gloves, everywhere there is no experience being required to supply for the government as of now. The thing is that we all speak so many things, but see, we are all using the foreign technology. For example, the technology what we are using is a Zoom, which is not belong to India, which is a foreign product. So I think we have to develop more products rather than providing service to the foreign countries. That is the first thing I would like to place here. We, the youth, you can see more than 50% of our population is youth. We can say 50 crore people are youth. So they focus two things. Basically, they focus two things. One is employment, also employment. That is the problem. The entire country, you see the mindset of any society, any religion or any, the parents they always kids to go for employment. Seen a parent no requesting kid or asking kid to do some entrepreneurship or build some business empire. They always look for their kid to be put in some software company or in some manufacturing company. They all want just a piece of salary. That's it. So I think the entire mindset need to be changed. Then only we can discuss about entrepreneurship. See, a lot of opportunities been given by Government of India. For example, CGTMSC loan is there, collateral free loan is there, but how are going to utilize this? For example, you see 600 engineering colleges are there in Tamil Nadu. Is it really required? Benchmark to become an engineer. Benchmark to raise such questions. And when we speak about experts and the technocrats, we always say IIT and IIM. That means the other colleges are not doing the great thing or what? So we have to create a benchmark to get into a professional education, especially in engineering. To our country is very important. I have seen that most of the speakers are pointing fingers towards bureaucrats. but most of us are not asking any of our youth to become politicians. Important. See, we all can speak here, but who will change the fate of this country? How to change? The elected representatives of the country. The parliament is going to change. So I think youth have to focus more on politics, entrepreneurship. There are people who cannot think more than employment, so they can prefer employment. But people who can really think out of box, they should always think about innovation, entrepreneurship, politics. They should really dedicate themselves to the country. And we are living in this present situation, COVID-19. You can see a lot of struggle that poor people are facing. Our earlier speaker used to say is very right that saying that whatever we do, it should reach the poor people. I've seen a lot of migrant workers, they are struggling, but see, most of the videos, what you are seeing in the internet and all, they're all pretty old videos. Whatever best can be done from the government of India, it is already done to the society, and we are just doing the follow-up. See, but the fake videos which have been floated in the internet creates a lot of misinformation. I think that needs to be sorted out. And secondly, the most important thing is that personal protection equipments. I'm insisting that India is 100%. Whatever is the procurement. For example, I think more than 60 lakh PPE kits being distributed from Ministry of Health and Family Welfare to all the state governments, and of course, state governments also purchasing PPE kits. They are all Swadeshi. They are all Indian made. It's not from any foreign country. It's not from China. It is all Indian made, and we have the capacity. Only thing, we have to motivate our youth. Organizations like APJAKIF International Foundation. I think we have to engage youth into innovation activities, and secondly, we have to engage them in a practical study. See, I see one thing. I'm basically a computing student. University only. Vishwanathan sir is here. So basically, I don't understand one thing. See, I actually, sir, I passed out with the distinction. That is separate thing. But I just want to say this. Few subjects which are really not relevant to the my future, my career. For example, I say, I really don't know where I implemented the subject. Queuing theory, yes, that is a really good subject. And numerical methods, I really don't know what I have done. Discrete mathematics, and I'll tell you one of the interesting stories. When I was doing the engineering, I think Anna University has done research on our batch. They have put innovative subjects into curriculum. It's a discrete mathematics, which really that way, especially in the 7th. Thought of going into the practical life when you put such a big subject on our head, and it is not connecting to the future. And especially what I see is the entire 4 years of education, I see lack of skill development. There is absolutely lack of skill development, and people who are pursuing education in engineering colleges are just like, I think more than 40 years there is no upgradation happened in the engineering education. This is the time that we have to think, we have to put industry-based education. That is required. See, one simple thing I would like to raise here. Engineering graduate who spend almost every year, let us be fee, including book fee and everything. The examination fee, I think let it be 45,000 rupees, 50,000 rupees. Together it comes around 2.5 lakhs to 3 lakhs. And after he got the graduation, education, he will go to the specialized course and get trained in some private center. Like, for example, if you want to get trained in Python, he has to get to NIST and or otherwise CSE, some private bodies. Why not that education, whatever we teach in engineering colleges, why can't based on what he likes? Subjects, but end of the day, the elective subjects are chosen by the college, not by the student. Sir, correct me if I am wrong. I think the smile can understand. So the college decides what I have to learn, not myself. So I think we have to change basically the entire education system. It's very simple. See, changing the education system doesn't mean that we have to change the entire grammar. We're not going to change the grammar. It is like basically what I like to learn. I can learn. But you have to create the infrastructure. For example, today you see a lot of engineering colleges. They built for 1,000, 2,000 students. What about them? Now hardly 20, 30 students are studying in that engineering colleges. Because of why? No jobs. This means you don't have quality graduates to take into your company. That is what our Mr. Narayana Murthy from Infosys says, that most of 90% of the engineering students, they are not employable. Employable. That means bring integrated education curriculum, integrated syllabus. That is very important. What industry demands, that need to be put into the syllabus. That is very important. And secondly, COVID, we are going to face few issues. One, unemployment. That everyone will accept this. Unemployment is going to be a big tough thing that India is going to face. And I'm sure that the Honorable Prime Minister of India is going to look into all these things. Somehow we are going to fix the issue. And the second important thing is hunger. Going to face a lot of starvation is going to be one of the big thing that India is going to face. So each one is a very important subject that we all have to work. Each one. ABDUL Kalam International Foundation is connected in almost all the states. Am I right, brother?
Yes, brother. We are connected.
So probably you can engage all our activists. We can say that no, let us feed at least 10 people or 15 people every day. I think it is possible by all of us. That we cannot depend always. For example, I tell you.
Since you asked this question, I have an interesting answer. In Maharashtra, we are already covering it in Maharashtra. Maharashtra team is covering for the food. Only food we are feeding. Needy feeding.
Only food is enough.
Only food we are feeding entire Maharashtra. You can check out our website, and we are actually identifying people who are able to feed, and we are recognizing Angel of Maharashtra. We are appreciating their contribution.
So I know what you are doing. I just raise this because other speakers also will know what you are doing. So the most important thing, the other thing is that who are working in the infrastructure industry is going to face a big issue because the migrants already moved from the urban areas to their own villages. So now how you are going to the infrastructure? From where you are going to bring people? All these questions are there. I think we can sort out all those things, but we need time. As Jack Ma rightly said, Alibaba, the chairman of Alibaba company, now don't talk about the business, just talk about the survival. Survive 2020, I think 2020 years. So all we have to do is, India is doing pretty good job, especially recovery rate is superb, and treatment is wonderful, because I strongly believe that one thing, even though I am from as an advisor to the Honorable Union Minister of Health and Family Welfare, taking care of media, I believe that one thing is integrated healthcare process. In Kerala, what happened? They strongly believe that Ayurveda and Siddha is modern medicine. So they implemented it. And even Tamil Nadu, like Kabasura Kudinir, we strongly believe that. And in fact, golden milk is nothing but, I think we all would have had it. Like milk with turmeric powder and a pinch of pepper is called golden milk. Integrated healthcare practice is what is required in India, and with this, we can really come out of this situation. We are expecting that maybe in a month's time that we can come out from this. Basically, with the help of even private, I should say this, government, but also the private entities, private hospitals. They are handling tremendously. The situation is being handled tremendously by them. I'm seeing that, for example, Dr. Raja Amarnath, I have visited their ICU care in Narayani Hospital in Vellore. The service, what they are rendering to the poor people is something tremendous, which is really appreciable. In fact, our minister also visited that place. We need to connect the dots. That's very important. At this particular time, we should actually work on the field, put our thoughts to the field. We should activate all the youth towards the development of the nation. We got huge opportunity. For example, China, they are facing huge problem. Believe me, India is rising, and we need to keep our youth in the right track, so that I think the vision and mission of Dr. APJ Abdul Kalam can be done at least by 2025. I strongly believe that. So with this, I would like to conclude my speech. Any questions? No, probably we can answer.
Yes, sir. Dr. Amar Prasad Reddy, sir. Thank you so much for the session. Definitely, I think we would have added you to an education session instead of healthcare, because you said more about the reformers on the educations and required more the change in the education sector, so that the India can also have a very good developed stage where we are now. Is there any queries from our panelists or the organizer committees who are in the Zoom, so they can post it to the three doctors who are there, maybe one or two maximum. Then we can go to the
question. I have one question to Dr. Raja Amarnath. Can I?
Yes, sir. Yes, sir. Sure, sir.
Yes, sir.
Doctor, see, very simple thing. So, if we lift the lockdown, if, for example, the 4.0 is not coming, if we are going to lift the lockdown, what will happen? What will happen? I know what will happen. I know what will happen. I just want other speakers also to know.
First of all, I must thank you so much for acknowledging our services. You know, a couple of times you mentioned our.
I have seen your service. I have seen your service in person.
Thank you so much. And sir, I must tell you something. Scientifically speaking, lockdown is only a temporary solution. Again, once you open the lockdown, you are back to the previous situation which was there before the lockdown. So people are going to meet each other often. More people are going to infect more people, and ultimately numbers are going to go up. Precise reason of lockdown has been, as we all know, to flatten the curve. You also mentioned in your in your message that the curve is flattening. So what will happen once you open up the lockdown? Curve starts rising. One important thing I have been telling everybody, because I have seen the sanctum sanctorum of the inside of the COVID ICU and COVID ward, and every day we are working there, that stop worrying on the number of patients. Start worrying on the number of people who are inside the ICUs or who are seriously affected. That is what the number you should think of. Platforms I have represented every time that the mortality rate is less than that of TB, less than that of H1N1 or swine flu, even less than that of dengue. That is called average mortality rate. Suppose you take 100 people of each disease and you take 100 people of COVID-19, the mortality rate has been very low. So having seen this, everybody is talking about number one, death rate or the number of COVID patients, the problem statement. Also, you all have mentioned, especially you mentioned right now about each one care one and the economy problem and starvation problem. I think this is the time both the integration should also happen between health experts and government, where you have to draw a fine line saying a balanced approach where you have to ensure economy also should not get affected. Of course, also the numbers also should not get affected. How to do it? This history has already proven 100 years ago for the Spanish flu, almost the same scenario has been taken care of. You open the lockdown for some time, again you do the lockdown. There is a series of, a methodology has been already described by several scientists in this field. Similarly, you can't open up everything now. So you have to open up only the crucial important services which are backbones of our economy, and then give entire support to those crucial services so that the economy boosts again, and cut down unnecessary things. For example, if you look at entertainment industry, malls, things like that, I am not against them, maybe they can wait for some more time. Food industry must be given importance immediately. Manufacturing industry, what are the essentials you have to take care of? So like that, if you do that, even if you open the lockdown, it will not affect either the health or mortality of the individuals nor the economy. This is my personal opinion.
Yes, doctor. Thank you so much, doctor. I think I invite our Sheikh Dawood sir to thank all the panelists who have done a wonderful session on the dreams of Abdul Kalam sir, so that we can go to the next session of education.
So I wholeheartedly thank
you so much,
Dr.
Thank you, brother.
Yeah, thank you for short notice, Dr. Raja Amarnath. Thank you so much for the presence with short notice. Yesterday night only we could call you, and really thank you for your time. I thank Dr. Sardas. I thank Dr. Mohan. That also short time we called him up. And thank you so much for all the time. Thank you, Amar. Thank you.
Thank you so much, doctors and Dr. Amaprasad Reddy sir for joining the session. I think next, I think we over with our scientific research as well as the most important healthcare. I think the next the highlighted is education, because Kalam sir always say that whatever the profession he likes, he was a scientist, technologist, advisory, and even a president. He likes only teacher, become a teacher, come back to my own university, teach them, and love the students. That is his dream. So we have a three eminent educationalists, we can say that, or eminent professors in all the whatever field they were. So we invite the three panelists for this education. That is we have a Dr. D. Vishwanathan sir, who is a former vice chancellor of Anna University, and we have Professor Sultan Ismail sir, who is again a professor at New College, and he has an Eco Science Foundation. And we have Professor RSS Mani, and he's again an ITM vice president, also an HR specialist. So may I go with the first panelist with our Professor D. Vishwanathan. So a brief introduction about him is he's a bachelor degree in mechanical engineering at Annamalai, and again a production and masters in College of Engineering, and a PhD from IIT. And he was during his PhD program, he worked with Missile Project, which is sponsored by Excellence Dr. APJ Abdul Kalam sir, when he was a director in DRDL in 1984. He's also very close associate, and he's a vice chancellor of Anna University. And during his tenure, I think so many visions of our Kalam sir has been arrived by our Vishwanathan sir. Definitely, I think the vision of Kalam sir in how to behave beyond Vision 2020 and challenges and opportunity on the field of education. I'll over to Dr. D. Vishwanathan sir. Sir, please go ahead. Your session is with you now.
Can you hear me?
We can hear you.
At the outset, good evening to all distinguished speakers. Can I hear Gautam?
Yes, sir, we can hear you. Please go ahead.
Yes, sir, we can hear you.
Thank you so much, sir. Thank you.
Really, my hearty congratulations to Abdul Kalam Foundation organizers. Thank you very much for giving this opportunity to be included in this conference. At the outset, our ex-president Abdul Kalam was a student of MIT. Anna University was in his heart always. We gave opportunity for him to come to Anna University as a visiting professor in the year 2001, after he retired from the government service. I'd like to recall my association. I started my research work with in IIT Madras by his project from the year 1984. In the year 2002, when he became president, he interacted many times. He set a target to the government by 2020 to be an advanced country, to develop the country. For that, he fixed this target to the government. Many times he told, this is not Kalam's vision, this is a national vision, government of India's vision, he said. So accordingly, he was hoping only on the youth. 3 years of time, youth will definitely contribute for the development of the country. Accordingly, he was hoping only on the youth. 2 years of time. Yes. The youth will definitely contribute for the development of the country. Yeah, that was his hope. He used to speak to the students. There are 6 crore students in his past 10 years, 15 years time. 6 crore students. First thing, he developed means he wanted to eliminate the poverty in the country. Citizen should be below poverty country in the country. First target. Second, nobody should sleep on the platform. Everybody should have a housing. These 2 things has to be achieved by the government. We can develop technologies, we can develop industries, rockets, defense, anything is developed. This is the fundamental development we must have. So we have to achieve this goal in 2020. Let us take another 5 years time. Let us fix 2025 at least. We should be able to achieve this Kalam's vision. Concern is to achieve all the technologies development nationally and internationally. We should have a good education. It is the fundamental rights and fundamental requirement is not there. We are able to achieve quality in both school education and higher education. You take Tamil Nadu. 9 lakh students are passing +2 every year. Then, even 400 students are able to join in all IITs. IITs together. 10 students are joining the exam, the medical. So this is the poor quality of education. Achieve the quality. That is my concern. It is too much interference in the education system. First, that is to be avoided. The graduates. 20% of the students are employable. Some students are not employable. Sad. Second thing, engineering graduates are working as a taxi driver, all engineering jobs. Why? Quality is down. Second thing, we don't find students aspiring for research. Motivate the students from the school days onwards towards the research. They used to say that development of the country should be based on the technology. Technology should be developed in India itself. These technologies. We find students going for research. We have engineering colleges, private arts and science engineering arts colleges. They don't get any fund for doing research of engineering colleges. Only universities are getting some scholarships. So, in all these concerns, my experience in the 40 years in the field of education, I think very seriously how to improve the quality of education. National level, our higher education enrollment is only 23%. This country, our Amar Prasad Reddy sir very clearly explained all these facts in his presentation. Want to talk? He has already spoken. I am very happy. He was a student of Anani. The institute and collaborations are almost nil in our country. Countries like US, 50% of the university's income, only the sponsorship from the industries. That is not at all available. We have to take quality education. In Tamil Nadu, for example, sorry to say, 14 years the syllabus was not revised. They can improve. So certain priorities should be given by the state and central governments. To achieve not only Kalam's vision in 2025, we have to further go ahead of Kalam's vision. Superpower country. Resources. Is human resource. Painful to see the migrant workers. These are workers. They are all youth. Youth are working as laborers. Trained to give education to all these dynamic youths. The youths are having the 55% population is below 35 years. This is the right time for us to define goal for education. In another 5 years or 10 years of time, just that government of India and the state government should join together, develop the education system. Research has to be initiated in every state. Just to establish research centers, 3 to 5 research centers in each state. Centers will focus on centers may be established under public-private partnership model. Central government, state government, universities, engineering colleges, industries can sponsor the research center. Teachers working in higher education institutions can enroll for research in those centers. Centers can do to enroll at least 1,000 teachers per center. And those centers can provide skill development for teachers. These teachers can train the students. Teachers can act as an EDP centers, entrepreneurship development centers, and they can train the teachers. The teachers can train the students. The development of technologies should start from these research centers. EDP training is also facilitate as technology incubators. Students can take the technology and guidance and start enterprises. Government of India has come forward to give so many facilities, schemes, aids for starting small enterprises. We are definitely successful. My suggestion, start at least 100 research centers in our country in the coming next year itself. 100 private partnership model, common research centers should be established. Center may require at least 200 crore rupees at the beginning. 3 year 100 crore investment. We can beat any country in the world. Research and development. The college teachers are not able to do research. The engineering or arts and science students are not able to pursue their research. You can take the help of the retired professors. Yes, there's no retirement for the professors. We make all the professors retire by 60 years. 60, our professors are very free and knowledgeable, free to guide. Utilize this manpower so that the employment can be generated. Mission is some of the students should be employable. Today is only 20%. It should increase up to 80% of the students should be employable. And another 20% of the students should be trained on entrepreneurship development programs, guided for starting small industries. Two things are achieved. We can overcome the poverty, we can overcome the unemployment, we can develop it as an economically developed country. And the school syllabus must be uniform throughout the country. You know, I don't know what happened to the government of Tamil Nadu. 14 years they have not revised the syllabus. Situation should not arise in the future. Every 4 years, school syllabus should be changed, and we must follow the CBSE syllabus. And all school teachers and college teachers should be trained properly. Suggest the norms are there for the school teachers. They must have a B.Ed training to become a teacher. Higher education also, we should bring a law that they must have 1 year minimum to program before joining as a lecturer or assistant professor in the higher education. The skill of the teacher is developed for teaching. So the higher education, interaction with the industries, they must be given training in the industries also. Teachers today have that training from the industries. It is a compulsion. When go to industry, they will not know how to teach the industry, both industry to the students. The way the micro, small and medium industry concepts should be brought to the classrooms. To be motivated, they will be inspired. One line about the agriculture. We have shared many times. ABDUL Kalamji, he shared a meeting with us 4 to 5 times. How to link to the rivers. Which are all the rivers to be linked? Prime Minister takes a step to the Ganga Kaveri river. Huge employment potential can be generated, and moreover, agriculture also will be sustainable, and we can live in the world. Much for your opportunity.
Okay, sir. Thank you so much, sir, for your very a wonderful session on the so many education reformers required, as well as the dream of Kalam, sir, how it can be enabled, and more of R&Ds and entrepreneurship, and much more. Definitely, I think the sectors of education should be they can really look, and they have to bring it back for our the dreams of Kalam to achieve that. So I think we will go with our next speaker. We have our Professor Dr. Sultan Ahmad Ismail, sir. I think this panel has 3 people. One we have engineering professor, one we have science professor, and another we have a management. So we have Dr. Sultan Ahmad Ismail, sir. To say about him, Ismail sir works with the Department of Science and Technology of the Government of India in the development of module on vermicomposting as a sustainable ecological practice for children. He also conducted a pressure projects for the Environment and Forest Department, Government of Tamil Nadu, state for implementing vermicomposting in 50 schools in Chennai, and delivered several lectures more than 200 schools in India and abroad on environmental awareness, solid waste management, and vermicomposting. He is currently working with Consumer Association of Penang, that is CAP, in an effort to promote awareness of organic farming, vermitech, and waste management to education institutions and organic farmers of Malaysia. His other area research is on the anti-inflammatory properties of earthworm, the ultrastructure of the perennial status of earthworm, and the electrical bioluminescence of earthworm. He has received so many awards for his wonderful work, and he was also a professor working in New College as a head for the Department of. So thank you so much for your presence for this webinar conference on India Behind Vision 2020, challenges and opportunity on the education. So it's over to Professor Sultan Ismail, sir. Sir, over to you.
Vanakkam. I am happy to share my information today, but I would like to be introduced as a teacher. I have been teaching for 45 years, and this is my 46th year of teaching. And I would also like to say that I have been a member of the curriculum committee, which revised the entire syllabus. And I would like to bring to the notice of Mr. Vishwanathan that the government of Tamil Nadu has revised the entire syllabus for all the classes last year, and the first batch with the revised syllabus are appearing for their examinations. +2. So the syllabus has been revised. What I would like to tell you is, as far as our education system is concerned, we come from a different background where we have a sort of a system where there is some sort of a coaching at home and there is a sort of a formal education that we send to schools. Our school system, the previous syllabus, which was not revised for a long time, there is a lot of complaint that our children are not able to successfully appear for competitive examinations because the weightage of volume of syllabus was not enough. Yes, in fact, even when I used to talk to children, school children, I used to tell them that children from state board, please read CBSE books if you want to appear for competitive examinations. Today, with all pride and honor, I can tell that even CBSE students should read state government books if they want to pass competitive examinations. I would be, in fact, I would tell with all pride that the government of Tamil Nadu books today are the best books in the country. In fact, we went very high even before the NCERT could do. And I would like to bring it to your notice that it's only the government of Tamil Nadu books which have QR codes in them, and children have to just flash their smartphones to reach videos concerning every chapter. Books of Tamil Nadu government. And they have come in Tamil as well as in English and also some other vernacular languages. We have a problem. When we wanted to write these books, we had the rural children also in mind and also the city children in mind to create a balance. So we had referred, I was asked to talk about school education and not of higher education. So I'm concentrating on school education because that's what Mr. Dawood wanted me to talk about. Now, we had compared syllabus from Finland, from Singapore, from ICSE, and from our state, and then formulated a syllabus which would give weightage for our children. Yes, competitive exams is a must, but we have a sizable population of rural children. We have wonderful persons like Yelongo seated over there who is going to talk later about how he improved his own village. Now, when you start looking at those concentrations on how to improve the syllabus, we created a balance. And luckily, last year's NEET examination, 9% of the answers are available in state government books. Achievement which you could make. But I have a sort of a question to ask. I've been thinking about NEET, about IIT-G, and all the people who spoke, the panel before us, the doctors, were praising the medical fraternity that they have done a wonderful job of saving the populations of this country. And all these wonderful doctors did not pass NEET. Okay. Marks were the ones which gave them the medical seat. And these children of doctors are the ones who are at the forefront today. Not a single NEET doctor who is there now who is practicing and saving the lives of people. So NEET is only an examination to evaluate the child. But why should we not evaluate the child who has gone through all this education for so many years? So many years of education. So when you start looking at it, I should appreciate and thank the government of Tamil Nadu for taking this step, especially the education minister. And I heard when the previous speaker was speaking that there is interference by the government. As a committee member, one of the 8 members who revised the entire syllabus, not a single time, no government official did without work. We had a wonderful system with the SCRT, and thanks to Mr. Uday Chandran, who was a wonderful officer who was associated with us. Beautiful. But today we are facing a problem. We are facing a problem because of the new things which have happened. My question to all the learned people over here is, you people keep blaming school education, saying that we are not able to produce children who are not competent to enter or into medical seats or into other higher education. Why is it that you select students based on marks? Another yardstick on which higher education can be made. Why is the system of higher education selection points for students? My own example, I'm telling you, sir. I was supposed to be a failure in mathematics. I was so poor in mathematics that I still remember my maths teacher taunting me saying that now these were the 2 words which are going into my mind till my 10th standard. In 11th standard, I got a wonderful teacher who started teaching me mathematics. I worked hard for mathematics because I was afraid I will fail in mathematics, and I scored 100% in mathematics. Scored only 48 in science. I was interested in science. Supposing I apply for any course in a college, the principal will say, you have got 100 in maths, you study maths. No, I was not interested in maths. I was afraid I will fail in maths, so I got 100. I got 48 in science, I was interested in science, probably because I was innovative in my writings, which was not there in the key of evaluation given for the examiners. So the examiner gave me 48, but my knowledge was more than 48. Science, so I achieved science, and today I'm a scientist, right? So please, can we change that pattern? Higher education, can you select? I even asked Dr. Ramasamy when he was Vice Chancellor of Agriculture University. I asked him in an open meeting, Why don't you, sir, select students based on whether my student can use a spade, a manvetti, a gadapara, and then select a student? Why are you selecting students based on marks to do agriculture, and these students go and join banks after that and work for the bank as officers? In the bank. Can engineering colleges, medical colleges, all arts and science colleges throw open to the knowledge of the child and select the children? If we really want to have and grow our children, and really, Mr. Vishwanathan, if our children have to go in for lots of research and innovation, we have to change the pattern of admission into higher education. Don't blame the school education. School teachers are doing a wonderful job to whatever possible they are doing. Yes, there are limitations. And today, you see, even for education, school education, please don't mistake me what I'm trying to tell you. Please don't mistake me. I got a report saying on the newspapers about how the students will be selected and what they will do during this quarantine period or this COVID classes. How a school child should face this. The expert opinion has been taken from big chancellors of private universities. And the chancellor says that we are able to do this for 45,000 children by laptop. Sir, number building a grammar clerk. If our children in all the rural areas, do we have enough facility? Even connecting on to this, sometimes I fail. I am doing webinars for some college children, but my videos don't work. We don't have enough bandwidth. And how are we able to reach our children? And they are giving new nomenclatures. Physical education classes will be merged with digital classes. Fair enough. Digital classes or any of the technology can only add on to the physical class, but cannot replace a physical teacher in the classroom. Not replace a physical teacher in the classroom. And they want to give new nomenclatures. The physical class plus digital class combined will be called as digital class. PHYGITAL. New nomenclatures, new fee structures, new money, and new things. Education has to reach to the knowledge of the children. And if that is going to happen, I have a feeling that many children, many parents will start reverting for homeschooling. Fear of this. And through homeschooling, they may appear through NIOS, National Institute of Open Schooling. Why not? Why not? Even these children can be somebody in life. We have Mr. Nandakumar, who is the Deputy Commissioner for Income Tax, who passed through NIOS, who is a big officer today. So, education is how much knowledge we get. My only request to you is, can we start looking into these infrastructures? Can we, bring in selection patterns which are different? And can we concentrate on vocational streams? Yes, Government of Tamil Nadu has offered vocational streams. Unfortunately, when I speak about vocational streams, some teachers misrepresent. But it is not misrepresentation. We have to give vocational streams because a child after school, whether goes for higher education or not, should be competent to survive. And if a child has to competently survive, some sort of a technical knowledge in hand, some sort of a job in hand, some sort of a quality in hand, which this child can do. And agriculture can be one of them because I have been working with a lot of farmers over there. Questions have to change because it's going to be online. Please open questions, creative questions, analytical questions, bring in analytic questions, bring in practical models. There are wonderful new programs which have been created along with the Department of Science and Technology, Government of India. Incidentally, I'm chairman for the Scientific Review Committee now over there. We have an IRIS program where children can be innovative. Innovation needs to be encouraged. We have to go in for all these changes. Why not we make use of FM radio? Make use of our regular television programs and try to promote knowledge and reach children rather than going through this digital and digital things. I don't know how we are going to overcome this present situation. Teachers are being taken for granted and they say that teachers can come. Yes, teachers are ready to go. But to invite a teacher from the red zone, how are we going to invite that teacher? What are the precautions to be taken? If a child is going to come from a red zone, what are the precautions to be taken? And then people immediately say, there's a big classroom, we'll put all the distances will be maintained, children will work. I think about it. I think that most of the people who are giving their opinions in the press associated with big digital classrooms, smart classroom schools and not with rural schools. Rural schools in mind, which is a sizable population of my country, it is better that we start thinking how best can we include the vocational stream and how best we can try to mold our children prepare them for the next, in the future, to make our country self-reliant and self-dependent. That is possible, and that was a dream of Mr. Professor APJ Abdul Kalam, and I'm sure that most of us who are associated with education will work towards it and see to it that we have a wonderful future and have Professor Kalam's vision achieved. Thanks very much for this opportunity, and good luck to all my fellow participants.
Thank you so much, Professor. I think you have enlightened more on the reformations already happened. Definitely, I think that has to be executed, and we need more corrections to be done to achieve this dreams of Kalam. So definitely, it may happen. Thank you so much. I think next we have our panelist, Professor R.S.S. Mani. He's a management. He's a vice president of ITM group of institution. To say about him, he has been very active as a HRD specialist and mentor in the areas of education management, organizational behavior and career guidance for over 18 years. He is currently involved in advising several blue chip companies and business schools in Mumbai and other metros. He continues to contribute actively in HRD of the present and the future generation professionals, masters and PM and IR from the prestigious Tata Institute of Social Science, Mumbai, and he has been a gold medalist. He is a HRD and management strategy expert associated in value-added intervention to many reputed companies in the domain of HRM, institution building and identifying, and T&D, corporate strategies, OB, OD, and allied facilities. Associated in training and consultant activity with large number of corporate entities across the globe from various fields. So, President and his team, committed professionals under the banner of R.S.S. Mani and Associates, are actively involved in delivering high-quality, value-added HR services to very valuable organizations like L&T, MM, ICICI, Tata Group of Company, Exoga Technology, Reliance, REL, and many others. Advice of management and career planning portals. We have Professor R.S.S. Mani here. So, this session is over to you, sir. Please take up.
Everybody, and thank you very much, Gokul, for that very generous introduction. It's always nice to get into forums like this because inevitably people say a lot of good things about you. But having listened to so many stalwarts before me, it's been a wonderful learning experience right from afternoon till now. We are in awe always of Dr. Abdul Kalam, and we have had the fortunate experience that in the ITM group of institutions, along with the Kalam Foundation, we've been involved in several projects, particularly in the field of education and trying to reach out education to the masses and to rural India. That's where we work with Dawood, we work with the entire team of Kalam Foundation, and thank you so much for having me over this evening. Look at perhaps what was a key point made by Dr. Vishwanathan, and that is how do we really look at increasing the scope of employability of students who come in for higher education. I think this is a major responsibility of the educational institution. Dr. Sultan was rightly saying, school education today has really in India blossomed, and we hope and pray that it becomes much better and better. But my greater concern is institutions of higher education even today perhaps are continuing to teach in the school mode. That is, we will continue to give you the textbooks, you learn the subjects, you write the exams. To say, sometimes at the end of the whole course on higher education, be it engineering, be it management, be it design, be it paramedical sciences, I have to face the flack of industry professionals who tell me, you know, you guys have got a degree, but they haven't learned anything. This is a big problem we are all facing. The teachers who are in the institutions of higher education, though extremely highly qualified, masters of their subject, feel that their ability to translate theory into practice, their ability to build a bridge between academia and industry is often lacking. In the ITM group, we always promote a very, very interesting concept, and that is, just like students can do internships in companies, we encourage our faculty to do internships in companies. The reason for this is, it's always easy to say, here is a sales report, Has anybody really gone in depth and found out how a sales report is actually made? Or how can you make all kinds of it look very attractive? Where I'm saying the practical knowledge thing that we need to focus our energies upon. Dimension to this whole worry about employability. I know today people are talking first about life, then they are talking about livelihood. They are talking about, do you have a job at all? And that's where employment comes in. COVID times, and I'm sure they will pass. That we need to ask is, how do I build a robust system where I am producing corporate ready citizens? Rightly say, it can't be done by only one set of stakeholders. The faculty, the students, the institutional heads have to take responsibility. Worried about students, and many of us who are here in this webinar who are very senior professionals, both from industry and academia, will agree with me. Today, perhaps, that the moment he has joined a professional course and paid a high amount of fees, his job is done. Want to spend his energy and efforts in adding value to himself or herself. This is the biggest tragedy of our system. A student is trying to get admission into a management school like ours. His first question is, what has been the top salary in your campus? Actually, he's asking me what kind of faculty you have. Do you have collaborations with some good universities? What kind of internships do I get? The inevitable question is, what is the salary which was highest in your campus? Here, perhaps doesn't come with a larger vision that he is here to build his career. Learning as an activity is just about restricted to how do I get the highest paying job on campus. Sometimes even students don't mind jumping specializations just because a company is giving a higher salary. Where the real problem begins. It's like saying you have a person who's interested in finance who's asked to sell credit cards. Both parties ultimately get frustrated in the process. What I'm trying to suggest is we need a robust system where the student has to be told from day one that you have got into the institute, welcome, but there's no guarantee you will get out of the institute unless you add value to yourself. If we are able to enforce, I think will tremendously add value to the process, tremendously add quality. He said, we have all perhaps an equal amount of talent. The question is, do I have an opportunity to develop this talent? This is what Abdul Kalam sir used to always say, that India will be that kind of a proud country where every Indian has an equal opportunity to develop his talent. Whether he is in urban India, rural India, whether he is highly privileged or underprivileged. The dimension which I want to highlight upon, very much so, is that in today's changing world, has to go through a process, be it student, be it faculty. So many of us have already experienced, notwithstanding whatever the constraints might be, higher teaching in many institutions of higher education has gone into the digital mode. Rightly said that stay safe and stay blessed. The thing they added on these days is stay digital, because that is here to stay. Rightly said by Professor Sultan Ahmed too. It's not going to be easy to run the traditional classes the way they used to be before. Reads the UGC reports and the AICTE recommendations. We are talking about having social distancing in classrooms. Classrooms, if I had 60 students, I'm perhaps going to be allowed only 30 students. That means I need double the number of classrooms, which also perhaps means I need to work in 2 shifts, because space is the biggest unavailable commodity in this country. I have to run 2 shifts. I think I'm almost going to become like a factory which works in 2 shifts. I need more faculty. Where do I get them from? In India, as most of us know, and I feel so miserable because I've been in teaching for 35 years now by choice, still considered the last choice profession. It is considered that profession where you say, let me retire from my corporate career and then I will get into an institution of higher education. To anybody who is a senior practicing professional. But the times we wanted you in the peak of your career, we have perhaps never been able to get that corporate executive. Stage when the corporate executive has retired, he would like to come and offer his services. I see a huge disconnect in this whole process. Coming from is, we need to go digital. The teachers have to now realize that no more the custodians of information. Information is freely available all across the globe. Converting this information into useful knowledge, putting this knowledge into practical application which could be appreciated and accepted in industry, that is going to make the difference between a value-adding teacher and a student who is ultimately going to add value when he joins an organization. All of us in higher education should actually have this commitment to help transition our students from campus to corporate in as smooth a manner as possible. That there are some students attending this webinar. I just have 2-3 small little suggestions for you. In the current scenario, it might just happen that many of you might feel that in search of an elusive admission that you are waiting for, all the delays in the entrance exams and so on, you might think of taking a drop for this year. My humble suggestion to you is, please don't take a drop. Continuity in education could go against you in plenty. If March 2020 was so bad, God knows what will happen in March 2021. No one can predict the future. Therefore, my suggestion is, even if you do not get into the best institution that you dreamed of, get into any good institution which is offering a similar course and try to make that institution the best institution. What is an institution's reputation governed by? The quality of faculty, of the alumni, and of course, needless to say, the quality of the students. Important thing that I want to suggest to many of you is please develop your soft skills. It's important to be technically sound. It is important to know your fundamentals of business. But ultimately, when you get down to the corporate world, you have to learn to work in teams. You have to learn to be able to support each other. You need to develop philosophies like win-win. You need to be able to cope with stress. This is broadly what are called soft skills. In fact, I personally feel these should be called hard skills because they're very hard to acquire and they're equally hard to practice. So I guess while you're at home during the lockdown, and depending on which state you are, it's going to extend for a couple of days more, a couple of weeks more. There's going to be slow lifting of lockdown. Please use all the time that you have to develop this soft skill so that you develop your overall personality in this process. Use this little opportunity that you have because of unfortunate circumstances to ensure that you're adding value to yourself. Great corporate citizen of the corporate world and that of this country. Not the least, I'd like to end with a favorite quote which I've always heard Dr. Abdul Kalam quote. You should confirm that you have become successful. Signature becomes an autograph. And I hope many of you reach this level of success as you progress in your careers. Thank you very much for your patient listening. Thank you all colleagues on this panel. There's been so much of learning today while listening to all of us. At this point in time, considering that my time is up for now, I'm signing off, but I'll be happy to take any questions at any given point in time. Thank you very much.
Yes, sir.
Yeah.
So Gokul, we are open for questions in this panel as they might come forth.
Yes, sir. Yes, sir. Yeah. Thank you so much, sir, for your session. Is there any queries is there inside the panel? Other panelists, also the organizers who are in the Zoom, so we can open up.
Since it is an educational panel,
and almost everybody they put their views forward very well at their levels as Vice Chancellor, as a professor, as a management professor, Vice President. But the issue is that whether syllabus of course as Professor Ismail said, already revised. I think somebody should mute their phone, some cross communication. Yeah. So more than syllabus and that the present era, but I'm also for the past 40 years in technical education, as the former Vice Chancellor knows, even Professor Ismail knows me. More than that, the teachers should have a passion first, number one. Number two, the local industries. Mechanical engineering student passing out without touching the tractor or without knowing how to drive a tractor, it's not a mechanical engineer. And the electrical engineer without touching the wire, whether it's 118 or 320 or 720, they are leaving the campus. This is a very bad part of the present teachers level. I am totally, not that simply blaming the teachers, I am only blaming the system altogether. In fact, the last 2 years plus I was in Nasik as a founder Vice Chancellor for Sandip University. From first year onwards, I put the entire system under outcome-based education. And first year students onwards, allow them to go to industry very periodically and you see what is happening from the first year onwards. Not students alone, both teachers and students together. Because the so-called learned faculty, they never seen what is 3D printing and what is CNC vertical horizontal machining. But when this exercise been done, initially, of course, there was some resistance. And moment the people started moving, industry, Nasik, there are more than 2,500 industries nearby. Moment they started moving towards industries, industrialists has come forward, throwing the problems at the first year level, throwing the problems at the second year level, throwing the problems at the MTech level, even throwing the problems at the PhD level, I would say. Even we have taken some good problem from Su-30, HAL, that Indian Air Force Station, Ojar. So why I am saying, see the leaders of the institution, whether it is a principal or a Vice Chancellor or a Dean, they must really, take these people on board. Unless until by knowing Industry 4.0, now even somebody was talking about Foundry 4.0, I believe Dr. Mailsami Annathurai. So many 4.0s are there, all in papers. But unless until we change ourselves, digital era, nobody can change. Even as Professor Mani said, you don't require, double classrooms. You allow all the urban students who are accessible to the Zoom at village, at their doorstep. Don't ask them to come here. And all the rural students, allow them to sit in the classes. You teach them at the class and how to learn through digital. I think this is where a paradigm shift is very much required. Simply blaming here, there, I don't think so will be a solution. But students are very intelligent, whether they are from the rural background or from the urban background. Urban and rural divide is not there on intelligentsia, because this is my past experience. I think with this note, I would like to close it because many more questions will be there. It is only my observations and suggestions. That's all.
Sir, to respond to you, that was the proposal that teacher training is a must. And, for example, I'll take computers as an example. Python was introduced for schools even before BSc Computer Science syllabus was revised. So, that sort of a thing had happened. And only now workshops are being conducted after 1 year for teachers. So 1 year, the teachers were finding it very difficult. So teacher training and strengthening the teachers. I would disagree that all teachers don't have passion. Teachers have passion. Probably teachers are put to more other non-academic activities in most institutions than for academic activities. That has to change. Attitude has to change. In one of the states, I don't want to mention them, teachers were asked to go and regulate the crowds which were going to liquor shops. These things have to change. Teacher has to be respected. Teacher is not just any other person. Yeah. So things will change, hopefully as before. Yeah. Thank you.
Teachers should not go, sir. If they say liquor shop, they should go to the home instead of liquor shop. That kind of attitude we also must take.
There's the government orders. Right? It's very easy.
Even government orders, okay. They are asking me to, drink from a Dasmark. Can I go? No, I will not go. I will.
Because regulating the crowd, but
even regulating it all the more. He's a passive smoker, passive drinker, sir.
Yeah, there was opposition and they stopped, but we have to think in their lines, sir. Teachers.
Of course, I agree, sir, but I agree. But certain things we should take progressively. What world goes, we must also go along with that, sir.
Okay, sir. Thank you so much. I think.
Gokul, can I have one question?
Yes, sir.
Yes, sir. See, I'm from the industry, but then it was extremely motivating and then thought-provoking to hear that the education side is really willing to cope up and work with the industry to find the gap and then make sure that we have at least 80% of people employable. So, what is your practical suggestion? I mean, what do you think is the practical suggestion that can be followed? I mean, of course, one of those could be, like doctors have a 1-year house surgeon course, where they have to be hands-on. I mean, a doctor cannot learn operation by just reading books. An engineer, so he should be put on the factory for 1 year. It should be a minimum requirement to pass the course, to pass the degree, to come out. Otherwise, as someone exactly Mr. Nalan Rameswaram said, an electrical engineer doesn't know how to change a tube light.
In fact, there are two dimensions to it, Sashi.
Yeah. Yes,
we have two kinds of constraints. One is you are a very progressive industry person who is making this point. When we approach industry for any such support, where we have faculty going to do some special projects or internships, as I mentioned to you, you'll be amused when I tell you that many companies say that we do not want to expose everything to the teacher who comes in. A lot of it is confidential. You feel even let's say, for example, a form which is used to predict the capacities of this week, unless it is filled, I don't think it is confidential. The form becomes confidential after it is filled. This is one dimension. I have another peculiar problem. Not every teacher is ready to unlearn, learn, and relearn. They almost are telling me, I have been teaching this for the last 18 years. I know the subject very well. I don't think I'm going to change my style. None of these are excuses. What we really want is a robust academia institution partnership, whether it be along with a local management association, whether it be with any such body. I would like to say if a Kalam Foundation can try to build this bridge to industry and academia interface in a structured manner, as you said. If my next promotion depends on a 3-month internship as a faculty, which I did, if part of my KRA is industry training, I think it would make a huge amount of difference. Thank you for bringing this up, but I couldn't resist saying this because I think somewhere there are sufficient loopholes in both sides. And those who don't want to do it will always find the excuse, like we were talking about the alcohol example.
Correct. Thank you, sir. Thank you.
Thank you
one
so
point,
much, sir.
Gokul, if you permit, just one point.
Yes,
one
sir.
of the things which I think we need to introduce right in the junior college is get into a serious career guidance activity with the students. I very often feel that students have mentality, or students are still in India in a situation where the parent decides what they should be doing. If we can start a progressive step-by-step scientific method towards career guidance, I think a lot of careers will blossom naturally, and students will not get frustrated wanting to do engineering but ending up doing architecture or things like that. Thank you.
Yeah, thank you. Thank you so much for the panelists on the education sector. So definitely, I think all the people from various of engineering, science, management, they've given the valuable reforms, how the educations can be turned up to achieve the visions of our dream of our APJ Abdul Kalam sir. So thank you so much. I think we will be connecting you in the behind 2020 also, because the foundation is taking up lots of modes and leads. So definitely, I think your support is required to reach the Kalam's vision. Thank you so much, sir, and thank you. Since our Daud sir has gone for fasting, fast breaking, so I think he may not be there. So we wish you all for the greater success. So thank you so much.
Thank you.
Yeah. Yes, sir. So I think now we are getting inside the third session. So fourth session, sorry, which we have. I think we started with research and scientific, healthcare, and education. Now the important is industry. Yeah, because it's another big challenging job for our post-COVID. Also, the Kalam's dreams. He wanted more number of industry startup in India and give so much of employment opportunity and bring up the more innovations. How like he brought it, the scientific temperament of the FRP compound can be used for the calipers. So similarly, more R&Ds and innovations can be brought into the industry, and which can enable the people's the life to be so happy. So in the industry panel, we have four eminent people. Which we started with Professor Sadagopan, is the director of IIIT Bangalore, and we have TNC Venkatraman. Yes, sir. TNC Venkatraman, who is a Microsoft regional director, and Professor Dr. A. Rajendran, who is a Life Care Photo Labs Private Limited, and we have Mr. Shashikumar Gandham, who is a managing director of Salcom Industry. So we welcome all the panelists for the industry. So I think Kalam sir's dream. I think India should be like a self-reliance in all the industry sector. It's not only like an automobile or electronics or chemical. So he wanted everything to be initiated and made in India, and it should increase our GDP. Also give lots of employment opportunity. So with that, I think I welcome all the panelists here for our webinar conference India Beyond Vision 2020. It's a challenges and opportunity. So I welcome the first panelist, Professor Sadagopan sir. To brief him, he's a director of IIIT Bangalore. He's a graduate of Madras University, India, and Purdue University, USA. He taught for more than 25 years of at the IIT Kanpur, IIM Bangalore, IIT Madras, and IIIT Bangalore. In addition to short teaching assignment of Rutrax, USA, and IIT Bangkok. He has widely research interests that include operation research, multi-criteria optimization, decision theory, simulations, enterprises computing, program languages, database, multimedia, and e-governance. He has authored several books, chapters, and paper. He also fellow of IEEE UK, Computer Society of India. He is a senior manager of IEEE ACM and AAS. Professor Sadagopan consults widely across different industry segments, auto, manufacturing, banking, IT, and social sectors, and lectures and gives lectures extensively at corporates, industry events, and universities in North America, South America, Europe, Middle East, Asia, Australia, New Zealand in all aspects of IT. So I welcome Professor Sadagopan for this eminent panelist. Sir, the session is with you. Please go ahead.
Thank you for your kind introduction, and a special privilege to be amidst an amazing set of panelists and to be part of a foundation which carries the name of Dr. Kalam, whom we all revere. And okay, thank you. Okay, I would be very brief. What I thought was that I would just touch upon one point: what possibly COVID-19 can teach all of us. On the 1st of May, Chairman of Microsoft, Mr. Satya Nadella, very interesting statement. He said, we are moving into a world of remote everything. Beat a world of remote everything. Looking back, I think in the last 52 days, many of us in places like IIITs, what we have found is that practically we are able to do everything. Really significant reduction in quality. We struggled a bit between March 15th to April 1st. We tried several platforms, we tried several experiments, etc. It took a while. But from April 1st to today was 6 weeks, as was delivered practically without any glitch. And then as a head of institute, I had never stepped out of my apartment, and all the things of the institute were able to do completely electronically.
I'm not saying that this is necessarily the best or this is possible everywhere. Being only an IT institute, because we teach only computer science, so it's become much easier. And we are a much smaller school, so this is not necessarily scalable. But you actually realize that most of the banks have been performing fairly well. And the big baskets of the world could actually deliver to fruits to vegetables every day without too much of a glitch. So what it shows is that a significant amount of things are possible to be done remotely. We should, for the heck of it, try to do everything remotely. That's not the point. The point is that a significant amount of things can be done remotely. We should ask the simple question, particularly for a country like India, because we have some serious problems. We have a phenomenal amount of urbanization, which forces lots of people to come and ghetto into cities, whether it is Mumbai or Bangalore or Chennai, with very poor living conditions. Because there are no jobs in the rural area, they are forced to come here. And in addition, because of relative affluence, so we also have lots of us driving the cars, and we don't even give space for these people to walk or bike or cycle. So there is over-urbanization, too much of pollution, and of course the big problem which has become fashionable in Bangalore. Everybody talks about the traffic problems, except in the last 6 weeks. Okay, so Kalam were around, thinking if I could have a nice conversation with him, he would probably feel happy, because he was always talking of this Pura notion, right? Providing urban amenities in rural areas. Imagine that if 30% of the population of Bangalore, Chennai, Hyderabad moves out to smaller towns, first of all, the traffic problem will just disappear. And second thing is, we will possibly have enormous amount of money left, which can be invested. See, to make a flyover in Bangalore costs hundreds, if not thousands of crores. 1,100 crores was the cost of one flyover that got shut down. So maybe we could do much more of investment in the smaller towns and make life far more livable. And there is no reason why everybody has to be in these big cities. And I was very happy to see our CEO of TCS, Rajesh, talking of not more than 25% of the people have to come to office every day. And he is thinking that they had a plan of taking it by 2025. They are now thinking of doing it even earlier. So if the industry, which employs about 4.5–5 million people, if they can start and several other people can start, if you can release that huge real estate, imagine that these big 6 IT companies have 120 huge campuses. If they can release 100 campuses, we can have 100 first-rate world-class hospitals. And if people can actually work from smaller towns, obviously we have to invest in social infrastructure. We have to have, I think the youngsters do want malls and cinema halls, and maybe the oldies want hospitals and temples. We have to build all of them. But all of them are much lower cost. And I remember that in the early days of TCS, when many students did not get a chance to, employees after being our students, did not get a chance to go to America, TCS actually had a special allowance. Who could not go to America. It's called India allowance. See, this country, we used to have what is called city compensatory allowance. So I have a crazy idea. Imagine that if everybody is told that your salary will double if you move away from Bangalore, Chennai, Hyderabad, Delhi, and Pune, and Bombay. I'm sure there will be at least some people who are willing to go. And can we create a new Quit India movement? Instead of Quit India, now we have Quit Chennai, Quit Bangalore, Quit Hyderabad. I'm taking southern towns because I'm more familiar with that. And if each state can take 100 towns and significantly improve the infrastructure, probably with the less money than what they have to do in Bangalore or Hyderabad or Chennai, and things like walking and cycling, possible, but encouraged by design from day one, probably solve many problems. And you see, pollution is a 2-level problem, right? One is the pollution which causes problems. Second thing is pollution leads to a lot of health problems. We spend much more money addressing that health.
So if only we could possibly leverage and repurpose the investments in the right way, possibly we would probably achieve something. Something like this, we would not have thought about it because, things like remote working, many of us have been doing it in some sense. Possibly people would say that, look, it works for you, but you cannot work for everybody. But the fact is that so many people have been able to work without any significant degradation. And, most institutes are able to deliver reasonably first-rate education. Okay, I'm not saying that, so by no means, stretch of imagination, I am forcing this blindly to everybody. But wherever possible, maybe 60, 70, 80% of the time, if we can do it, this would probably, COVID-19 would have given us a new opportunity. This is much more needed in India because our urbanization is much higher. Second thing is our urbanization also means significant reduction for large number of people, which is not true of many countries. And we are still in the growing phase, and maybe we will create more jobs in a uniform way across the country, and people are already talking of getting manufacturing to this country. Obviously, manufacturing, if it moves away from the main city, it will be good for us. So this is something which I thought that I would leave it for thought, for discussion, and I also want the youngsters to kind of take a look at it. I still remember when Mr. Asim Premji made a decision of moving 250 people, maybe about 15, 18 years back, from Bangalore to Mysore. Within 2 hours, he got all the resignation letters. He actually had to take them back and drop the idea of moving to Mysore. I think sometimes I want the youngsters also to not think only of Bangalore, Hyderabad. They should probably discover that smaller towns can actually give great life for them. And now that connectivity being there, so they can always reach these big cities. So I think it is a thought process which they have to set in. They should accept that we don't want necessarily to insist on Bangalore and Hyderabad and Chennai. And if companies, and I'm sure all of us professors, if we could also kind of influence the students, together we would have done something good for the country. Okay, crazy thought. And the only thing I would say is, this is my understanding of Pura of Dr. Kalam. I had long discussions with him. He was my good friend. He was so kind to me on so many occasions. So I thought that I will post this. And a special thanks to Sheikh, because he is a person who made me to come here. Okay, so thank you, Sheikh. And thank you all, esteemed panelists. I am open for questions from the panelists or from the other people who are listening, and thanks for listening. Thank you.
Gokul?
Yes, yeah. Thank you so much for our Professor Sadagopan, sir, for your provoking session. I think what has not happened, I think COVID has brought so many changes. I think the 3 verticals post-COVID and pre-COVID was there. So definitely there will be lots of changes. Now the lockdown session, people are sitting at home and they're working, and so many things are happening what is not been thought. So definitely I think industry also, the certain sectors of industry will happen soon. So we will move to the next panelist, who's our TMC Venkat Rangan, and he is a white space leader and professional speaker living in Chennai, a software entrepreneur with 20 plus years experience, starting, growing and selling a company that operated in India, USA and UK. He was a Microsoft Regional Director, honorary from 1999, and IEEE Senior Member, Advisor for APJAKIF International Foundation, House of Kalam. And he is also a member of Professional Speakers Association of India and delivers engaged for talk for leading corporates and startup. So may I invite our Venkat sir for the session to take up. So please. Your voice is not audible. Yeah, I think we can hear.
Yeah, sorry, I forgot to switch on these things work when you press the on button. Okay, thank you organizers and thank you Sheikh and the foundation. It's really my privilege to get an opportunity to talk amongst an expert set of panelists and I'm really humbled to get this opportunity. Let me keep it brief. From an industry perspective, I'm helping a couple of, after my exit in my business, an IT service business for 20 years. I now work with few startups, both in India and US, help them from an advisory capacity, both from technology and
No, we can't hear you, sir.
You are not audible. We can't hear you.
Can you hear me now?
Yes,
Yes, it's better now.
Oh, okay, sorry, it's my mic. Okay, so I've been sitting in a couple of webinars, both in US and India, about startup investment and venture capitalist panels and others. So what I kind of hear, they are suggesting three main things, which I thought I'll start with by sharing what I'm hearing from a lot of people and what I feel also will be the thing for industries, especially startups. So this message is more for students who are thinking about starting and for startups who are at various stages. So I'll put it into three buckets. It's a very brief message. So first thing is the startup should acknowledge, yes, the world has changed. We are in an uncertain scenario. That's the number one message that startups should actually take to the heart, that things are not normal. That's the most important thing to remember. So once you do that, once you understand that we are in a different scenario, then we have to say, acknowledge the problem, then we have to look at which stage are you in. If you're already in business, the first thing is conserve your cash. That's the biggest message I'm hearing from a lot of people, because this issue of COVID or resolution or whatever people have to live with it or whatever, let's leave that aside, is not going to go away. So you need to run your business for a long time and you have to conserve cash. And that's number one. So look at ways in which you can conserve your cost. Where are you spending money? Take a very hard look. This doesn't mean you have to go immediately start firing people. That's not the message. Start looking at all your the cost that you are spending, and then see which cost you can avoid, which is not adding to your value, which you can minimize, which you can defer. Do all those SWOT analysis and planning and all that. So that's number one. Conserve your cash. Second, if you are in a business and you are making sales, some of your founders have to go aggressively towards collecting money from your customers. Every customer is having a problem, right? From government, central government has a problem paying state governments have a problem, municipality have a problem paying to the individual business. This kind of keeps going down. You work for an enterprise, your principal customer, they have a problem paying you. So your employee can't pay their milk vendor, so on and so forth. Let's acknowledge that, but then unless you ask, customers in India don't pay you. The time is normal days itself, 60 days, 40 days doesn't make any in India. So in these cases, it matters more. So you need to follow up with your customers, beg, borrow, or like say, don't steal, but beg, borrow, get your money. That's very important. Cash flow is extremely, I've seen businesses, for no fault of them, have just died because of cash flow problems. Fantastic business, great profits, but you don't have cash to pay your people. You don't have cash to pay your interest or whatever. So conserve cash, look at all your costs, and wherever you can cut cost. And if you can raise money, if there is a rain of money in your office today, please go and collect all the money and keep it. It's going to require, you are going to require that money more than ever. So that's the message. Those are the message if you're already in business. Second, if you're already in business, you have raised money. This is what many of the leading venture capitalists, both in the US and India, are saying. There was a panel by Rajan Anandan, was CEO of Google India, now with Sequoia and all that. He was in a panel for TIE Global shortly, and the biggest message he says is, Ian, the other venture capitalists were saying, if you have already raised money in the last 3 to 6 months, thank your stars. And normally you will be getting your next round in 3 months, 6 months, and all. You're not going to be able to raise your money in the next 18 to 21 months. That's what people are saying. So look at how your money, which you earlier planned for 3 months to 6 months, you can stretch it to 18 to 21 months. That is, it looks really daunting and impossible, but then you will have to do it because your subsequent rounds of funding is not going to come until clarity is going to come on this COVID issue, which is, we all know it's going to be a long time away. So stretch your money, how you can stretch it to 12 to 18 months. You have seen what Airbnb have done. You have seen what Cure.fit is doing, and a lot of people are doing in various forms and fashions. One size doesn't fit. Like I said, firing people is not the only way of saving costs. There are multiple avenues of saving cost and deferring your cost. And if you're, see, today there is no point in you putting a hoarding and spending or a TV ad when people can't really go out and buy your product. So if that's the case, save your money, push that marketing money some other time. So that, think of all the innovative ways in which you can save money. Third and final point, if you are not starting, if you started business, if you raise money, we talked about. Third thing is, if you are not started a business yet, you are planning to start a business, then you can extend this runway, how you can bootstrap your business, keep doing everything, pre-cook like a TV cooking show, because you're going to find it extremely difficult to raise money now. And like they said, another 12, 18 months for existing companies. Why is going to be a VC or an angel or a seed? It's not to say they are not going to invest now. Nobody has closed their wallets yet. That's what I'm hearing. But still, you are not going to get that money forthcoming. So you need to run your startup on your own bootstrapped money for a long time, maybe till this year end or early part of next year. So what you plan to do in 3 months, 6 months, kind of do it slowly but better. Keep doing things which doesn't require money. Lot of your planning, lot of your selection, lot of your marketing message, content, what all you can do without a lot of spending money. That. And then have a plan once things open up and things be ready to scale up very quickly. Have an action plan so that you can scale very quickly when the things become better. So those are the 3 primary buckets of message I thought I will share to all the people who have a startup or planning to do a startup. There's a lot of opportunity for India, especially in IT. So far, I've been hearing from a lot of people, it's only opportunities that are possible. And God willing, India comes out of this sooner and better shape. India is going to have a lot of opportunity in IT. More than ever, people have seen we can work remotely very well and all that. All this is going to work in favor of IT, which is a big strength of us. So I leave with those thoughts, and then at a later stage I have questions. I'll be happy to share. Once again, thank you all. Thank you, Foundation, for giving me this opportunity. Thanks.
How the new business can be engaged. I think it can be like enable our country to grow up, and definitely I think there are much challenges is going to face by industry sector. So definitely I think it can always come up in a very better way. Thank you so much. I think we have the next we have in our panel Professor Dr. A. Rajendran, who is a Life Care Photo Private Limited. So his short profile, he's a senior international advisor of photo medicine value chain development, chartered chemist, scientist, herbal clinic experience owner with a demonstrated history of working in the research industry. And he has a skill in pharmaceutics and good laboratory practice of GLP, also medicinal devices and oncology. He is a strong entrepreneurship professional with a Doctor of Philosophy, PhD in Chemistry from Anna University. So I think right now, the entire world is looking for such kind of a solution. Yeah. So I invite our Professor Rajendran to take up the session. So please.
Thank you very much for your introduction, sir. There is a small correction. That's phyto. I am a specialist in phyto. Phyto is a total plants kingdom. So originated from the plants, which is phyto. Our former Vice Chancellor knows that Ramachandran sir I am a man of aloe vera. I am the person who did the project in India 2000, which has got the best REGP in the country. I've developed many industries, nearly about 14 industries, created more than 1.5 lakh of people, employment generation in the country. So one of the visit had an opportunity to visit Dr. Kalam sir. Then he, after meeting that particular client, he called me from his office, wanted to say something. Then when I discussed with him, why don't you have done excellent work to the nation, why don't you do something for your hometown? That's the reason I started in my hometown. There is a small research laboratory. Clearly, I'm from the rural background. So I started in my venture in my rural background, that is in my hometown. It's a research laboratory that is starts from cultivation to finished product. There is a lot of confusion among this. People are saying that without feeding anything also, fertilizer and chemical, they are claiming it as organic. That is not a way of organic. So the organic practice, we'll have to educate when you go for an international market of this product. There is a lot of clarifications, a lot of testing protocols, a lot of information is required about the residual toxicity. So in order to educate them, to invite the students for the project, and then to give the better products in the phytomedicine, phytoceuticals. So I created my own laboratory in my hometown. I'm giving the projects to the students, and then for we are making commercially for some therapeutic, prophylactic nutraceutical products, phytomedicines, Indian medicines, of course. I'm not in oncology. I'm totally into phytomedicine, phytoceutical, phytonutraceutical. I'll share a small presentation for your understanding. Yeah. Sir?
We can hear you, sir. You please go ahead, sir.
Thank you, sir. Thank you. Okay. The natural product is the most important source for the immunomodulation. Nowadays, there's COVID-19 is a big issue. Everyone is claiming that for the immune reasons. So when the immune is strong, and definitely there is a fighting nature to disease and infestations. There is a comprehensive program for identification, cultivation, evaluation for these herbal medicines has been developed. This because it's a primary source for health is about 70 to 80% in the world population based on the use of the medicine plants derived from the traditional system. It has been used for generally I recommend people to go for a natural products in the extract form. The current practice is only for the churna, that is the direct churna, direct powders they are using it. But instead of that, if you do extraction and isolating the active compounds, that is the organic source of the inputs, the extraction and isolating the active compounds, which is responsible for the particular targeting the indications. So it can be used as a food product, can be used as a cosmeceutical, nutraceutical, pharmaceutical, and even for agro also. From waste to wealth, even agricultural, from the waste also can be used for the treatment of the agricultural crops, that is called an eco-friendly biodegradable products. To phytotechnology, medicine, the phytomedicine obtained the herbal source with great demand in the developed world as they are able to cure many infectious diseases. So the drugs which is from the phyto-originating is an outstanding contribution to the modern therapeutics. When we do for extraction process in a scientific way, enriching the active fraction, definitely there will be a bioefficacy, and that will increase the bioassimilation and the activations. Thus, integrating the phytomedicine into the health system should be developed such as bring in the harmony. Modern system can have the minimum threat to each other. So then this extraction, the phytotechnology, there is a different method of phytotechnology. There is a whole process of the aloe vera, so there is no influence of the heat which is not required, and so different category of products can be used, different species used with the different methodology. Now the artemisinin and anua, I think that is their drug in Madagascar. They are recommending for the COVID-19. This artemisinin anua, I gave this one to, presentation in the Nigeria, that is in Abuja, NMPDC. It is like an Ayush, like in India, it's an Ayush in NMPDC in Nigeria. So that was in 2012 I gave this the complete technology and production demonstration, everything. Now the Madagascar government has released as a COVID-19 control as a prophylactic uses. Natural products, coming to the natural products, is increasing by 8 trillions. The global market insight of plant-based ingredients market is growing trend. So naturally, people are turning towards the eco-friendly natural inputs. Need the phytotechnology. Increase the life expectancy globally. They increase the incidence of lifestyle. That is, so many diseases like diabetes, hypertension, anxiety, and cholesterol, particularly for the obesity, is a significant increase in death due to the lifestyle diseases. This happened worldwide. Resources of the natural resource is naturally is available about 80%, but what we are using is utilizing only 20%, and that 20% will definitely increase, and then to the 80% is contributed by only the Ayurvedic, Siddha, Unani, Amchi, and the Western homeopathy. The core objective of this is the the advancement of the phytotechnology. Now the current practice is there to use only the churnas. If you make it into a more advancement of the phytotechnology in the refined form, innovate the range of the complete application to tell, and this will do for the socio-economic development for the by the establishing a viable low-cost technology as per need of the budget. The standardization and quality control of these products processing will improve the export potential. So the indigenous strategy of aimed for cultivation operational additions to the national vision. So like that, it's another area of biotechnology. It's a collection of the scientific techniques used to improve plants, animals, and microorganisms. The classification of this, the genetics engineering, molecular markers, molecular diagnostic, vaccines, and tissue culture is another thrust area. To enhance the agricultural biotechnology, a safe and sufficient food supply grown in an environmental responsible way, essential promote an eco-friendly agri-biotechnology, empathize by promoting an eco-friendly natural pesticide, encourage the organic farming practices, proper use of the agriculture waste for another concern, burning them to burden the already critical pollution level. So the development of the technology will proper utilization of agro waste will be used for the biocompost for the same plantations. Of the agro products and utilization of underutilized resources. To support innovative ideas of value addition of agro products utilization under utilized resources, encourage the research and development and production of new agro-based products, to set up the state art of the productions unit development for agro products, to train the agro farmers to value addition in their agricultural activities, to promote the health products, phytomedicine, dietary supplements, and nutraceutical range of products. The biofertilizers and biopesticides. This is the important of the biopesticides is to free away from the residual toxicity, because nowadays the farmers, they are using for enormous amount of the more than the recommended dosage of the pesticides. It will retain the plants and leaves, and the residual toxicity will retain, and that will affect the human consumption. To avoid that, we let educate them to the inorganic fertilizers and pesticides as detrimental side effects to human health. Using the biopesticides and bioorganic fertilizers is advocated. So this can be the program, and those who are coming for an entrepreneur as well. Another, another resource is that the sustainable marine resource utilization. Marine biosphere resources are being exploited unmindfully. The support measures is identify specific resources and innovative methods to conserve them. To work with the Forest Department for conservation of Gulf of Mannar Biosphere Reserve. Similarly, for the seaweed also in the Rameswaram area, it's a countless of marine plants which are algae available. So in the sea as well as the river, lake, and other water bodies, we converted into value addition products for more of therapeutic values. For example, that's a deficiency syndrome of the iodine, which may causes the thyroid enlargement that is called the goiter hypothyroidism. Can be cured by the using the supplement of the seaweeds. Resources can be utilized, available plenty in the Rameswaram area. Used for the agar and then algin and other carrageenans are used as food additives. The measures will be taken care for the consumption of seaweeds, contains the vital nutrients of the biomedical values. Market potential is increasing the growing trend. It has been used for the food, beverages, pharmaceutical, animal feed, and agriculture products and cosmetics care.
Sir, we've got another 2 minutes more, sir.
Okay. Socio-economic empowerment. This can be created by socio-economic empowerment, mostly for the grassroots levels. Striving those Newton corner for the coastal community, and alternative income can be generated in community economic empowerment to take a disseminate for the technologies to the coastal people. So, concluding that, considering all these available resources from near around Rameswaram area, so the Dr. Kalam vision can be implemented. I'll be supporting in always by developing this as a phytotechnology, agri-biotechnology, marine biotechnology as areas, as all the 3 areas as challenges. We shall move forward to innovate the opportunities by using indigenous strategies to the nation vision. Thank you.
Yes, sir. Thank you. Thank you so much, sir, for your presentation, as well as how this agricultural biotechnologies and marine can help in increasing the medicinal activities, especially in the healthcare sector. So, thank you so much. I think we'll move to the last the panelist of this industry session, Mr. Sashi Kumar, who is a managing director of Salcom Industry. So, Mr. Sashi Kumar is currently the managing director at Salcom Industry. Salcom is a Finnish company and the world's largest manufacturer of mobile phone charging, supplying to top 20 OEMs of its major customers. Salcom has its manufacturing operation in India, China, Brazil, also offices in Finland, Taiwan, Japan, US, and South Korea. Salcom was established in India during 2007 as the first global charger manufacturer and currently has 3 manufacturing sector in India, employing more than 7,000 employees at 2 sites, that is in Chennai and Noida. So Mr. Shashi Kumar is associated with Salcom India since its inception and was responsible for sales and marketing and sourcing functions at Salcom before being appointed as the managing director of Indian operations. He has been instrumental in transforming Indian operations to a high-performing unit within the group, and Indian operations has today become a significant part of Salcom's global footprint. So definitely, I think we welcome Shashi Kumar and managing director. Also, he is taken responsible of how to take up this Vision 2020 from the House of Kalam in March 2019. So I welcome Mr. Shashi Kumar to this conference, that is India Beyond Vision 2020, the challenges and opportunity. It's to you, Shashi Kumar.
Thank you, Gokul, for this generous introduction. And first and foremost, my sincere thanks to Dr. Kalam International Foundation for giving this wonderful opportunity. And anything you speak of Dr. Kalam, I think you must be very privileged to be talking on this subject, especially today, and more so with all the eminent panelists and people who have really accomplished so much in life. And sometimes I envy, when people start telling them, especially when Professor Sadagopan was mentioning, Dr. Kalam is my good friend, and then I have been working with him on long times. Unfortunately, sir, I didn't even have a chance or opportunity to see him in person. So that is one of the biggest losses of my life, I would say, not being able to meet him. But nevertheless, I've been so much inspired by what his thoughts have been for the nation and the actions as well, and his humble and simplicity and a very crisp and clear direction for the nation, and especially the year 2020. So, as we all know, if I may take 2 references from where he was mentioning about he mentioned a nation where agriculture, industry, and the service sector works together in symphony, and a nation where the rural-urban divide has been reduced to a thin line. I think these were 2 of his wishes, or the guidelines to the youth and the nation. So this is the segment that I represent. So I just want to give a few updates on that. There was one item which he spoke also very clearly, which is called the law of development. I think he clearly spoke about the divide between developing nations and a developed nation. So what are the aspirations of both a developed and a developing nation? Of course, both of them want to grow, and to grow, competitiveness is the key. And to be competitive, there are critical 3 dimensions, like a 3-legged stool, which have to be balanced for a very prosperous development of any nation or a company, which is the service and product quality that we do, either a product or a service. So India is mainly a service, and also now getting to be more of a product-based company or a country. So quality is of utmost importance, and he has really spoken about it in his speech. And cost effectiveness, of course, you can produce a high quality and can provide a service which is best of class, but it must be affordable as well. So cost competitiveness is very, very important, or the effectiveness of cost level, it's quite important. And the next dimension is, of course, you can have both best quality and best price, but you must be able to serve the customer when he needs it. So on-time supply or on-time support. So these are 3 dimensions that he really spoke. And I think we are still an aspiring nation to be able to meet these dimensions. And if I can go more towards that, in the current scenario, of course, technology has really changed the way that we work, and especially these 45, 50 days. I think, and especially IT, the information technology and digital phobia has really increased a lot with almost across all the citizens in this world. But what does this situation provide us? So I would like to kind of take this in 4 levels of discussion. So one is first and foremost, with this current change of the entire scenario globally, I think there isn't one nation or one economy or citizens who have not been touched or impacted because of this pandemic. I think there is almost everybody in this world. So while this is happening, so companies also, there is going to be a rebalancing act. Instead of globalization, I think there's going to be a regionalization or focus towards one particular segment. And I have to really tell you, from the industry perspective, India is in the right spot. I think India is in a very, very lucrative and the best position to capitalize the current situation that we have on hand. So therefore, from my point, I would say the 2020 that Dr. Kalam envisaged, probably this was the day. Or no, maybe he thought about this big change coming up already those days. And maybe this COVID-19 is one of the via medias to make all of us realize that, we have responsibilities and we do have an opportunities on hand in a great level. So if I take first the technology, I think that has been one area that he has also focused a lot, and where we also can do as a nation quite a lot. So what's technology all about? End of the day, if you cannot have something, that you can reach to the last citizen of your nation, or, the bottom of the pyramid, it's you cannot say that you're very successful. Of course, you have touched some level of the organization or, the country, but then only you can say it is successful only when it reaches the bottom of the pyramid. And what's that? I think this digital, simplified and smart techniques, and especially, right now we call this JAM, which is Jan Dhan, Aadhaar and Mobile, to some extent has really changed the way Indians look, work and act. So thanks to that, and we really have a great opportunity in that area as well. So reaching to rural, I think is very, very important, and not just reaching products, but making sure that the products are also produced in rural areas. I think that's what it is, which I would like to touch upon it later. And end of the day, what is the purpose of an industry? The purpose of an industry is to serve the needs of the society. And of course, by serving the needs of the society means, as I already mentioned, reaching the bottom of the pyramid and to an affordable level and making profits with a purpose. So that's where industries play a key role. And from technology point of view, we have been able to meet or come to certain levels, but we are not there yet to a level where the developed nations have reached. So therefore, this provides the biggest opportunity for us as a country to grow, and not only for India, but also for rest of the world. So if I can take an example of my own industry, which is basically, electronics and mobile phones. Today, as we all know, electronics has been, there isn't one industry which doesn't work without electronics. So it is a fact. And this is here to stay. So when this being the case, you need to have one, of course, quality, no doubt, and then, affordability and your local supply chain. So these are three key areas to focus, and mobile phone industry is definitely making headway in this direction. And about 97% of phones that we supply in India today or use in India today is proudly made in India. So this is a fact as we have on hand. So in these areas, there are a lot of opportunities for entrepreneurs. Today, most of the components are still imported, while some part of the products are produced locally, but then many of those are imported. So this pandemic situation also provides a great opportunity for entrepreneurs. So this is the second one that I would like to speak about, which is entrepreneurs. And this is the right time for all the youngsters. If you have to really do something or you want to focus something, this is the time, and this is the golden opportunity to focus on entrepreneurs, on it, to make startups, because one, you have a very conducive environment, and second, you also have proper support that's providing from the government, and third, also there is a momentum in the nation that where people really want to support and bring up the local champions or local heroes to be growing and moving forward as a global companies. So I hope our people from India, all these entrepreneurs and startups would really become global companies and not just stay as local. So in order to do this, there has been a lot that we discussed basically about, in the previous panels about education and technical skills and how to bridge these skill developments. I would say as an industry, I kind of bring this up most of the areas, and we try to do as much as we can as well. This vocational training and then bridging industry and academia, I think this is really need of the hour. The reason why I say this is when we get people here, when we get students here, or once they've completed their degrees, when we get them here to the industry, they're just not industry ready. I don't know whose fault is it. Is this industry's fault because industry doesn't work with the academia, or is it academia's fault because they just don't work with the industry? So somewhere, it's like we have to bridge this together, work on this together, for which there has to be a platform. And unfortunately, in this nation, everything happens only when there is a necessity or a need or a force. So maybe there has to be a government norm or a guideline or a necessity that this both have to work together to be able to bring up the future. So this vocational training, meaning when people or when students are really studying engineering courses or diploma courses or ITI courses, so they will have to be taught hands-on, not just taught with on theory. Then in Tamil there is a very famous proverb, which says "Ettu surakai karikku udavadu." So this is what it means. You just have you cannot have a pump, the book used for cooking. So similarly, you have to have hands-on. So people, the students, must be able to visit organizations, work hands-on, and this should be part of the curriculum or their course when they complete. So that would, I think, to a certain extent, help improve the gap that we have today. And organizations definitely are willing to, at least in our case, yes, we are willing to see how much we can help out on this one. And the fourth item, I would say, basically is the developing industry itself. I think no nation can grow without having proper balance of industry. So when we talk about industries, of course, large industries are very important. Upon a time, they were a medium or a small industry. So therefore, it is very, very essential that we focus on developing and nurturing all these mid and small size companies. I think which is what also Dr. Kalam was envisaging in all his thoughts. How can we make first, citizens to be their own bosses, and then how can they serve the society next, then how can they serve the nation next, or then the serve the international community next. So I think so. Therefore, the most important part I would say is developing the local supply chains. So having products that we can buy quite quickly at a short time frame, and then with skills and knowledges that are made by our people, and then at the same time, I fully echo and agree what Dr. Sadagopan mentioned, which is basically, can people quit cities and move to rural things? I 200% support this idea. Industries as well cannot be clustered into only one area, which is towards large cities. So they have to be decentralized and then move towards sustainable locations. For example, tier 2, tier 3, even tier 4 cities, where you can see, because all those people come here looking out for jobs. Why can't industries go there and then set up factories where everything can be made? Of course, if you put up a balance between these two, there are reasons why industry cannot go today. But then this is one of the biggest opportunities that I would say, that developing clusters in rural areas which can provide urban amenities, so that we can prosper our nation, and so that it's all balanced all across the nation and not just clustered towards one part of a city or a state. So with these few words, I would say that as much as Dr. Kalam envisaged India to be a great nation by 2020, I think we are very proud. We have been able to achieve to a certain extent as what he envisaged. But then he did not say that India has to be at 2020. I think it was just it's a journey, and we are there today, and we will be emerging as one of the greatest nations in days to come. And we have a proper opportunity now on hand. So with these few words, again, thank you, Dr. Kalam Foundation, and thank you all my fellow panelists, and also the other sessions from whom we learned a lot as well during the course of the day. Thank you again.
Yeah.
Good evening.
Thank you, Shashi. I think it's an interesting session. I think most of the people have seen Kalam sir, but you said you never met. That's a highly inspiring his visions and thoughts. You are going to take it up throughout India, which you are already doing in Salcom. Almost 80% is women's employee doing electronic industry. So that's his visions might be. So thank you so much for all the panelists. I think we had a wonderful sessions in the industry. It starts with Professor Sadagopan, and then our Venkat sir, as well as Rajendran and Shashi. So each people have given their own dimensional view how to improve, why is the industry after post-COVID, plus like the vision of our Kalam sir. how this can be enabling our country's economy. It's very important. Also the employment generation. And more important, the youth, the people who are coming out from college, they have to be placed in the right place, like on a proper path, and they should be equipped with a proper skill development program. So thank you so much for all the panelists. Is there any a question is there for the industry panelists from anybody else who is there in the Zoom session?
Google, I have a question for Sasi.
Yes, sir. Please.
Sasi sir, so now, so in your company, so you are making mobile charges. We are importing to other countries, right? So other countries are recognizing our product, the best one, which is made in India, right? I'm asking the same question. If you are able to make, charges and import to other countries, why not other products?
No, definitely. So right now, as I said, you need to have a market. And then the second thing is competitiveness is also very important. And you need to have the ecosystem. Important when you are able to sell these products globally. So I'm sure right now, as I said, the COVID-19 pandemic is actually forcing many countries to relook at their supply chains. And this is the greatest opportunity that we all have. I mean, as a country, as as companies, as individuals. And yes, you will see many more products coming in the future.
Thank you so much, Sashi. Is there any other queries is there from our other panelists or from social media? So,
Google, in social media, there are so many questions. So we will actually circulate to via email and get the replies from them and answer it.
Yes, sir. Thank you. Thank you so much for the panelists, and definitely I think stay connected with our House of Kalam. So very important. The Vision 2020 is to be there in this year. So definitely we have taken the next level of beyond 2020. What is going to happen? So thanks for your being this panelist. Also spending the time with us, spreading the knowledge as well as your thoughts. Thank you so much. I request our Sheikh Dawood sir, the grandson of Kalam sir, to give a Thanksgiving message for this panelists.
Yeah, I thank Dr. Sadagopan sir, I thank Venkat sir, and Sasi Kumar sir, Rajendra sir. Thank you so much for participating in this conference. We are happy and we are grateful to you. Thank you so much.
Yes, sir.
Thank you very much.
Thank you. Thank you so much. I think the last session, I think it's going to be an interesting session for all of us. So because everybody would have been born from village and we came to the urban areas and so many of them not turning back what is happening in the rural. But Kalam sir, I think he has seen so much of upgrading thinking in the rural areas, and he brought the very big mission on the village sector. It's like a Pura, which is very, very important only to concentrate on rural areas, how to provide all the urban amenities, what we have seeing in the urban. So he was always thinking about how to bring up these farmers as well as their various promotions, their livelihood and many more. So we have a very eminent panelist for this, I think, who are very closely linked with our Kalam sir. Also, we are working with his missions, and he even reported in so many books like 3 Millions and everywhere. So we have a 3 eminent panelists. I think one is my own a guide, I can say, our Ilango Rangaswamy sir, and he is there as one of the panelists. And second, we have Professor Nallan Ramachandran sir, who is a former vice chancellor of Periyar Maniamma University, and we have a third, Dr. Sethu Kumaran, who is a founder of Sethu Bhaskara Group of Institutions, as well as Sethu Bhaskara Agriculture College and Research Foundation. So I welcome all the 3 panelists for this wonderful session. I think this is going to be one of the eye-opening sessions, can we say, because the Prime Minister of India and everybody started thinking about how to make made in India and how to bring back our own traditional culture and traditional activity. and people are thinking, can we able to go back to our rural village and we can able to make some kind of livelihood objectives of products. So definitely, I think that's the people are going to talk about it. So let me welcome all the panelists for this session, and I welcome the first panelist, our Sri R. Ilango Rangaswamy sir. So before he starts, let me give a short profile of him. So rural development, Mahatma Gandhi said that the India lived in village. He wanted village to be developed. While everybody talks on every platform, nobody takes a serious initiative. Here is the story of R. Ilango, a Dalit leader, turns his village into model village in India. Ilango is a former CSR scientist and former Panchayat president, Kuthambakam village, Kundamalli, Tamil Nadu. Born and brought up in Kuthambakam village in the adjoining district of Chennai city, was involved in social work right from his childhood. After completing his BTech in Anna University, he joined Oil India and shifted to CSIR as a scientist. His village Kuthambakam, with 4 hamlets with more than 50% Dalit population, was always facing a caste clashes. Due to illicit liquor trade, the poor villages was losing money, health, and family relation. Because of his entry, by resigning his position as a scientist from CSIR, he has become a Panchayat leader, and he created the Panchayat as a role model Panchayat in the, I can say, in the nation, and moreover, it becomes recognized in the globally also. He is the award winner of so many things, like I can say a few things. He is a Man of the Year award, the Week, and Real Hero award, and much more like Pudhiya Thilumarai, so many awards he has received, and he is always a mentor, a guider, and he's a close friend of Abdul Kalam sir, who always see about if Kalam sir thought about rural, he strikes with Dr. Ilango Rangaswamy. So I invite our Ilango sir for take up the session here. So please here. Sir.
We can't hear you, sir.
That is the rural-urban divide, sir.
Data connectivity.
Okay.
Rural-urban divide. You are absolutely correct. Yeah.
Rajesh, Bala, can you check up what is?
Yes, yes. We will check. We'll give him some time.
Yeah, sure.
Okay. I think we can start with the next speaker. I think.
No, local. Ilango sir is in mute. So
Yeah,
that's
yeah,
why.
yeah, that's
He
what
has
I
to unmute his phone, maybe. Yeah, his microphone.
Yeah. 1 second, sir. I think I tried his mobile number, it switched off. Okay, can we start with the second?
What is this one Google citizen? This plan thing, data. I believe that is his thing. Because I saw him a couple of minutes ago.
Yeah, he was there. Sudden disappeared.
Okay, go ahead with the next speaker.
Yeah, I think go ahead with our next speaker. Yeah, we have our Professor Nalan Ramachandran, who was a former Vice Chancellor for Periyar Maniammai College. Also, he is Chief Mentor for Manal Academy of Science and Research, N2 Technologies, and Kaveri Delta Agro Producer Company Limited, Tanjavur. I think his profile is very lengthy, and he is a part of like Pura project. He brought us Pura as a visionary, and he has implemented Tanjavur. And he is completed as a PhD from Tamil University on the architecture. And he is like founder vice chancellor of Sandeep University, Nasik, Maharashtra. Also founder vice chancellor of Periyar Maniamma University, Tanjavur. And he was being a principal, vice principal, and many more. He is also former director of Vijayar Graphic Research Center, Chennai, and former vice chairman of Computer Society of Tiruchi chapter, and much more. He has received WEC IEEE IAEP Environment Award and Best Citizen Award in 2000. Also, like Bharat Ratna Shri Vishwasharaya Award 2011 and Best Engineering Award by Institute of Engineering Tiruchi Local Center IEA.
I need more time to speak. Please stop it.
Yes, sir. So I just hand over the session to our Ramachandran sir. So, sir, you can take up the session, please.
Okay, thank you. A very pleasant evening to everybody here. Indeed, it's a very great opportunity to talk in the name of the great technological mentor of mine, Dr. Abdul Kalam, and which is being organized by House of Kalam from Rameswaram and of course Kalam International. Before I take up the session, actually this is an exercise which I have done when I was as almost different capacities as Vice Principal and Vice Chancellor of Periyar Maniamma University, now currently Periyar Maniamma Institute of Science and Technology. Of course, if you see this happening of this, particularly this Pura mission, of course, Tandai Periyar, everybody we know, the reformer of Tamil Nadu, whom Dr. Kalam has got an extraordinary affection and love towards him, because he has addressed in 1944, many of us, we were not there. He addressed, if you see the great man think alike, the slide goes both sides. He addressed on village transformation in 1944, the same concept, the same idea. Of course, Dr. Kalam has addressed as Pura in 2003. That's why we made it as a great man think alike, 1944 and 2003. When I became the principal, the present chancellor and my chairman, Dr. K. Veeramani, has given me a kind of a booklet, Ramapura Sirthirtham. From there, I picked up as a principal of an engineering college. We have started doing some work to transform the villages around the colleges, which are, surrounded by Vallam campus, that is in Tanjavur district, some villages in Pudukottai, and one village from Tiruchi district. This is where this work we have been started doing and deploying my own students. If you see the NCC, NSS, Youth Red Cross, Red Ribbon Club, every students who are in the voluntary services are deployed with, of course, we do normally these works, but connect with the Periyar address on Ramapura Sirthirtham, that is the village transformation. We are many years, after having done with so many years, I once upon, when we come across with Dr. Kalam as a scientific advisor, we have signed an MOU with the Ministry of Defense. By that time, I was sharing this information to our Padma Bhushan, Dr. Sudhan Pillai. Sir, yesterday when I was traveling from Chennai to Delhi, I was reading an article wherein Dr. Kalam was addressing a Pura. That Pura providing urban amenities to rural areas, which we have been deploying and we are implementing almost for 15 years in our campus. When I was talking to him, he said, okay, in that case, then you will have to talk to the president. And I was waiting at his office at DRDO, now Sena Bhavan. Almost 1.5 hours we were waiting. 2 o'clock suddenly call came. Dr. Kalam called me over phone. He was in a meeting, Dr. Pillai, and he allowed me to sit in his office. And Dr. Kalam, Dr. Kalam, is it Ramchandran is there, the PDR principal? I wanted to talk to him. Then I spoke to him and I was elaborating over phone almost 45 minutes. He was listening, hearing everything. And whatever we have been doing here in Tanjavur with the Periyar Group of Institution and the leadership of Periyar Engineering College, then is the world's women first engineering college, then said, yes, this is exactly Pura. Then in that case, what I said, you convey to your chairman, Dr. Veeramani, that I will visit and inaugurate this Pura. So this is how this started. And Sir has came and we have, whatever we have done, we have discussed, and me and my chairman, Dr. Veeramani, visited Rashtrapati Bhavan, explained the whole things, and thereby, by the time he was mentioning, this name should be made as a Periyar Pura. So this is how Periyar Pura has come. All the Puras like Chitrakulo and Vasna Pura, Periyar Pura considered to be the work which have been done in all these segments. If you see here, physical connectivity and electronic connectivity, then knowledge connectivity, economic connectivity. I always used to say, if any student or a teacher or a researcher, if they really practice this peak, that P-E-E-K, they will go to the peak, P-E-A-K. So that is the stuff normally I used to say. And as a principal, I was little even raising my voice while the educational aspects were discussed. The reason is, if every institutions, now Dr. Kalam was telling, we have 6 lakhs plus villages are there as of now. 6,000 puras are required, and more than 7, this corporation should be there. So like that he was addressing. And here in this concept, sir, we have taken about 65 villages, which are primarily located in the part of Tamil Nadu. Of course, this is where the Periyar Maniamma University now. Surrounded villages we have taken as a model, and we have started working this as a Periyar Pura villages. And what we have done, the mission of Pura is identifying, addressing the socio-economic needs of the villages. At first, this is what we have been doing. Sustainable use of natural resources and energy, whatever it is locally available. Then providing infrastructure, facility like housing, roads, physical infrastructure. Then dissemination of technical know-how and do-how. Because being the technological institution, having ITI, diploma, engineering, arts and science, pharmacy, all our institutions, technology, everything we have taken and placing them for the local needs and the public needs. And enhancing the knowledge and skills of the children, right from the school children, our own students go there, sit in their villages and teach them. Then, by the way, women empowerment. Those who are unemployed, underemployed, educated rural women, we also created one concept called Power, Periyar Organization for Women Empowerment and Renaissance, whereby more than 60,000 women are enrolled and given complete skill training. Now Skill India is there. In those days we have given skill training, and we have taken facilities from state and central government and done many things for women, for their livelihood and for their economic empowerment. And of course, coming to the farmers, we also made good agricultural practices of farmers. Of course, though we do not have agri colleges, we have connected with Tamil Nadu Agri College and local agricultural stations, R&D institutions, and we used to bring them experts, connect the farmers, and that is where even our own technological students, they join together both for their well-being. And of course, if you see this Periyar Pura village profile, then physical connectivity. I have told you what is Periyar Pura village profile all about. It was almost 65 villages. And what are the activities you have undertaken under physical connectivity? Then electronic connectivity, knowledge connectivity, then economic connectivity. These are the 4 connectivities Ayya Kalam used to address even in the Target 3 billion. If you read the book, every administrators and every youngsters who are in this session must read Target 3 billion. A book written by APJAKIF sir as well as Mr. Stephen Paul Singh. So these Target 3 billion books published by the Penguin publications, all must read so that you will completely understand exactly what the future 21st century is looked for. Of course, post-COVID is equally given an opportunity, self-sustainability. So these projects are also more of a self-sustainability. Of course, Professor Sadagopan was telling about migrating the people from city to rural. On the other hand, Pura addresses not stopping the migration from rural into city. So that was the concept. But because of this pressure, because of this virus present situation, now from city to they are bringing many things from city to rural. Rural is very safe, but their livelihood is very, very stake. With this, our intention, Pura major intention is stopping the migrant labors, migrations from rural into urban to minimize the loading, to make sustainable development. Then what is our future plan? So these are all the quick activity. Maybe I'll circulate before the honorable members of this August audience. The Periyar Pura villages, as I told you, there are 67 villages in 3 districts. Pura villages profile we have taken, and what are the tanks available, crops, what are they do, what are the population, how many farmers, what is the housing style, all those things we have done. And this is where the evolution of Pura, we have started, this is Periyar, I told you, 1944, he addressed on rural transformation, and slowly we have taken up various works, and finally, up to Kalam, if you see, there are 6 times, Honorable, our former President of India, 6 times has visited the Vallam campus, because the attraction is nothing else other than the Pura. So, very first time when he visited, almost he gave me for 20 minutes presentation. In my presentation, almost 1 hour has gone. So 8,000 students are waiting for his inaugural of Periyar Pura. So that is where always Dr. Kalam, anything he says, he will ask 100 questions. Unless we answer 100 questions, you won't believe anybody. Of course, friends, everybody knows it. At the same time, that is where you will ask question, give the solutions accordingly you are. That is how all our students, all our staff minds, everything completely transformed, and the whole campus, not only my engineering college, but also my sister institutions, my polytechnic, pharmacy, Trichy teacher training college, everybody in this mission was working very well. And this is the physical connectivity in terms of, de-addiction. Now you know how the task mark has gone up to even Supreme Court, even during the post-COVID. So our people are very much, addicted. So we have conducted de-addiction, HIV/AIDS, because we have a hospital here in our campus with the doctors, local Tanjavur Medical College, hoping everybody, all this medical campaign we have been doing all those things. Even once when Dr. Kalam visited the campus, even he demonstrated the telemedicine, tele-education by Wi-Fi network, not today, in 2003, when he first time, a President of India who visited a village called Muthuvira Kandiyan Patti, close to almost from Tanjavur is about 20 kilometers, an interior village. There are 50,000 farmers and women, rural people. They were coming with bullock carts, almost like, like very big festivals in a temple. They all visited, and the Kalam who visited and saw and almost conquered the minds of people. That is where, these even our students, according to their, program, this is MSW students, what they can do as a master of social work, those students, they go and meet the concerned villagers, farmers, they do psychological treatment, they collect details, they do social economy survey. So like that, every student, if it is a civil engineering student, they go and, discuss with their irrigation plan and irrigation implementation, even sprinkler irrigation, drip irrigation, whatever, do is not a question of mere theoretical. My dear friends, I think our Honorable former Vice Chancellor Viswanathan sir knows that whatever we have been doing, and we have established everything in our campus. Anything you ask, for instance, renewable energy, not today, in 96, renewable energy, anything you ask, alternate energy, everything is, even today, they are all functional, working in the campus. That is why we educated the teachers, we educated the children, and we have given importance. What is the importance of villages? What is the importance of the technology? Why we are studying? What it makes, change? That is why we brought the changes. And if you see the physical connectivity, the various activities, this all happened until 2017 when I was Vice Chancellor. The current data, now the present persons are, carrying it out continuously. Since yesterday, Mr. Salim called me and he used to talk. Dr. Pillai was suggested some students should speak on Periyar Pura. That's why I'm just using this data and I'm showing how the patients are really treated from the villages. We had permanent hospitals and we also had a mobile hospital. In a bus, we developed everything. Bus goes to every villages and they meet the people and do this, needing. That's why we have worked. And physical connectivity, if we see the beneficiaries, pre-I camp, general, of course, these are connected with the medical camp. You can see even coming to the, health aspects, and we also established a child line nodal organization. 1098, everybody knows child line. That also we established. Whatever schemes available in the state government, central government, every schemes are live and live wire. Even today they are working. And even 16% of the total children beneficiaries of 343 cases in the district we identified in the Periyar Pura villages. And they are in tandem, they work with the local superintendent of police and other service organizations. And physical connectivity in terms of, various, as I told you, the power means Periyar organization for women empowerment renaissance. Through that women, what are the things we have done? If we see the medical camp, then water sanitation, child care, and entrepreneurship development, then small help, self-help groups. In those days, self-help groups are very popular for both men and women. AIDS awareness, various activities have undertaken in this. And then village development plan. We have again taken the NABARD. They given some sanctioned money. Based on that, there are about 5 villages, namely Manayaripatti, Sengipatti. These villages have taken and studied and come out with their problems and solutions. Similarly, the village development plan. So these are all supported by NABARD. Even today it is available. The only thing is, our issue is that Government of India and Government of Tamil Nadu, they both put together, try to pump these inputs only to the universities. There are about, as of today, there are about 935 universities. There are about, 40,000 colleges and 3,000 engineering colleges. All students, if they practice this, what is known as the, the rural development program or rural transformation, the so-called rural transformation, now it is a smart villages, smart cities. Of course, Pura becoming the SPM urban mission. So in this mission, if we put all the educationists and faculties as a part of the extension and research, if you do extension, you will come with a problem. If we have the live problem have 100 solutions and lot of applications. I tell you, this is where our research should emanate. Otherwise, problems lie separately in rural India. Problems lie separately in industries, and problems are, were spoken in length with various slides, presentations, hours together, end with no solutions. But if you do sincerely this is a model developed, even out of target 3 billion books, out of 300 pages, Kalam has spared 30 pages for Periyar Pura. You read. So that is why we have done, and this is what you are seeing. And coming to the physical connectivity, repairing their houses, renovating their body.
Sir, for 3 minutes, sir.
Yeah, I will quickly finish. This is the electronic.
Yes, sir. Thank you, sir.
Yeah, I understand. Electronic connectivity. All the villages were connected with, Wi-Fi, and even we have been teaching children literally from my own campus. And of course, due to the paucity of time, so many data are there. Then electronic connectivity, again, the students, ham radio we were practicing, and we have our own, these networks with villages, FM radio, all those things we have done. Of course, whatever the knowledge connectivity through this education, training, bringing them here and forth, finally, of course, somebody, I think Professor Ismail was talking about vermicompost. This, we have established a vermicompost unit. More than 10,000 farmers are given hands-on training. Even today they are doing almost 50,000 tons in a month. What is the concept? Waste is wealth. Even taking any waste, we are converting into a vermicompost. Even we have taken Tanjore Corporation waste and we established a biomethanization plant wherein 100% methane gas is extracted, 100 kilowatt power generation is done out of gas, and the sludge goes to vermicompost. Worms are growing like anything. So whereby the local waste becoming the wealth. That's why the energy segment. Similarly, if you see bakery, bamboo cultivation, fire product, even bamboo, almost 10 acres of bamboo cultivation we have done in the campus itself. The whole campus, if anybody you visited, you will come to know it is almost like a forest, agroforestry. It is a completely denuded land, waste land. We are converted into oasis. And then moving to the further knowledge connectivity, that is what we have shown is all agro based. This is all engineering based. We have converted, 6 women welders. 6 women first welder in the country. Even CAA prize, and they have taken up to Thailand for awards. These are local child only who are 10th fail, 8th fail. They made us welders, and they were all got married. They are all settled in foreign countries. Similarly, fitter, carpenter, all those things. Even CNC training in those days, CAD turner, like that. All these kind of training we have done. This is what is called the knowledge connectivity. Once the knowledge connectivity, then economic, these connectivities are given, electronic connectivities are established. Finally, it comes to the what you call your economic connectivity. So that is what we have done. And if we see these value additions done, even during the what you call the tsunami almost major havoc like COVID virus. You see these tiles we have created. Many kuppams, villages, we have given hands-on training, and they were also even the sustainable livelihoods are established. And the economic connectivity, friends, once if you establish physical, and once if you establish the electronic, the media, once if you establish knowledge, automatically economic connectivity is sprout. That is the concept of Pura. Of course, that is where many things we have done in a phased manner. One such things I wanted to tell you, this Pura made the rural women who were employed with tailoring. They were working with, JETRO, Japan External Trade Organization. They visited even up to, Japan. And whereby these products are being sold, and those kind of work also we have done during this, this Periyar mission. Of course, by seeing various activities, now many ministries, many secretaries, many departments, they used to work with us. We also, BHL, Belsia, all, what we do, we take the unemployed youth who are breaking the street lights at their villages. We call them here and give them as a welder and deploy them in BHL, Belsia sub ancillary units. That is where their economy is established, their livelihood is established, and the program was very successful. So finally, the NSS, they get award. Even I tell you, one of our Pura student, because of she is thoroughly a NSS student, I also made every student should work 200 hours compulsory during the course of studies. Though they are completing their degree, if they are not completing 200 hours in extension, NSS, any of the work, the degree will be withheld. That is where I made it after I became the Vice Chancellor. And because of that, one of our students who became an IAS officer, so happened in the personnel board, the question were asked on Pura, and she was master in Pura, and almost she became an IAS, now serving in Chennai. So that is why Pura is really making lot of things. It should be complex. That is where we have to do it. And the special camps we continuously do. Area under cultivation we also made studied. And education, skill training, environment. These are all the future plan we have done. Of course, whatever IAS says in 21st century, these all we have done during our course of work. My dear friends, our partnering institution, always collaboration and partnering institutions and state institutions, central institutions, state departments, central departments, of course, state governments, central governments, almost all in put together industries. If you work this, definitely I tell you, the whatever local talents, whatever the local resources can be made full employment, and they become a liability into asset. That is what the concept of PURA. Even by doing our work, ministry, finally they called us. I even addressed for all the secretaries of Government of India before SP RPM start. Shyama Prasad Mukherjee Urban Mission. I was invited as a speaker about addressing this PURA concept. I addressed there in Delhi and educated them what we have done. In fact, what we have done here as a university, as a college, and how this entire PURA gamut, how Kalam sir visited 6 times. I made it by seeing that the secretary from Gujarat, they called me again, and Gujarat also started similar work, and I addressed all the secretaries in state government of Gujarat. Friends, by the time I visited one village called Punsari, even you can see now, Punsari village in Gujarat. They are the model village.
Sir, we have another 2 speakers. Sir,
I am finishing. I am finishing. So that Punsari village, if you just Google it, it's a modern village. Because what I am telling you, the leader, whether institution or a village or any administration, whosoever sits at the top of the brass, if they take lead things in the properly, possibly everything is possible. That is the answer from me. I think over which any questions, anything comes, I can always interact with them. I can work with them. Thank you very much for the opportunity. I always thank Ayya Kalam's family. I will be the part of the family. I will work with as a family for making India as a prosperous nation and a global nation. Thank you very much.
Thank you so much, sir. I think wonderful session you have thrown. We are all studied about only PURA, but we have seen what has really happened, executed.
We look forward to work with you on Shyamala Prasad Mukherjee Urban Mission. So we will work with you.
Definitely. Anything I am for it, and the institution also will help. Thank you.
Yes, sir. Thank you so much for this wonderful session, sir. We are so happy that you have described complete about the PURA. So we are so happy. Definitely, I think House of Kalam, along with our eminent panelists also, will join together to make much more PURA across Tamil Nadu, that become like a benchmarking across our nation to say that Kalam's dream is always like. So I think Balamurugan, can we connect Ilongo sir through mobile phone since his phone is in some issue? Balamurugan or Rajesh?
Sir is there actually. Right now he is available here.
Okay, I think can we invite our Ilongo sir, sir?
Hello?
Yes, sir.
Yes, sir. Yes, sir.
என்னுடைய கேமரால ஒரு தெரியுதா தெரியுமாட்டா இல்ல கேக்குது சார் கேமரா மட்டும் தெரியல நீங்க பேசுங்க சார்
பரவாயில்ல சார் நீங்க
நல்லா கேக்குது
பேசுங்க. We are waiting.
Yeah, great. So I've been also the talk on watching what's happening. Interestingly, the whole meeting started from Rajan sir, the whole thing. And one thing I want to emphasize here is this 40 days or 45 days or 50 days the lockdown. Everything is locked down. But people are, maybe affordable people are having money, or poor people are given some money by the government or small savings. With all these things, the whole country is surviving. It is surviving. It is living. Everybody is eating. Small people are distributing. What I am saying, I've been working in this vegetable, bio-based vegetable shifted to Tirumai, and I'm spending there. And every day, hundreds and hundreds of lorries are coming with vegetables, with ragi, with again, I've been traveling in the villages, the harvest is going on, the ID is lifted. So what they emphasize is, the whole country is in lockdown. It is locked down. Anybody, the whole 3 hours, 5 hours, 6 hours talk. Everybody talk the economy. We talk about industry. We talk about what will happen to China, what will happen to the relationship, what will happen to the Reserve Bank, how the cash will come, and all they think the talk. But humbly, the whole country is surviving. The whole country is living. The whole country
eating, that path is not locked down. It cannot be locked down. So that is the beauty of this country, the villages, the farmers, the food production chains, the food production industries. We can say industry it is not the chimney and the building, the fields, the farmers, the labor. All the people are working. That is why we have to understand, or not everyone is understood, that we have to emphasize and see the confidence on country, despite the sickness, despite the problems, the country is very happy. We can understand even 4 months, 4 months, 3 more months, provided if that is well, provided if that is rice, provided if that is meat, provided if the water is there. That is there. It is because of the villages. It is because of the community. It is because of the farmers. That is the beauty. That is the strength of this country. This I want to put it again. It's something like I'm bring it to the notice of the speakers, participants. That's why even beyond 2020, after this COVID and all, and everyone talks about the complications. Everyone talks about the problems, like because industries are not running, a big setback is there, money has to come in, where to export this stuff. These are all real problems. I'm not, but for my case, in my case, I've been traveling the whole state for the past 50 days, district to district, and running village reports and to study what's happening. But here, the real strength is the community. The real strength is villages. Here, real strength is the farmers, the green, and all these things. So what I'm thinking is, even I'm also one of the most loved person for Kalam, because whenever he says me that the pace and the energy level, whatever he used to get, I used to see what was the energy he used to get whenever he see me, whenever I used to talk to him. So what I'm trying is the whole focus of 50 hours, 4 hours talk. Yes, there is space and there is technology, there is big money, this and that. Beyond that, is it not the time to think inner? Is it not the time to think the inner resource? What is the real strength of this country? The real strength of this country to make the country to survive even happily for a few more months or 5 more months or 6 more countries, the local economy, the local resources, the manpower, all the boys who have come all the way from Odisha, Bihar, or anywhere, they came and they helped us, even Tamil Nadu, Bangalore, and all. But people like me, we used to talk more on local economy, localized, simple, sustainable. In fact, all these 3-4 hours we were listening. Where is the question of sustainability? It's question of survival we are talking. Question of management we are talking. Question of something we have left over, how to catch it up, that we are talking. Is it sustainable? And that sustainability part is a great question. Big question. If you are totally depending on China, will it be sustainable? If your economy is totally depending on Arab countries and oil-based economy, will it be sustainable? America was sustainable for something, but somewhere now they are struggling because of the health reasons. That's why it's a high time to think about sustainability. Yes, one side, the people are dying, people are walking, thousands and thousands of young boys with the backpack, they are walking somewhere to reach their home. Ultimately, their confidence in their home, their village, their origin. Despite they got money, despite they came for something and they end here, but ultimately the destination should be the home. Home is the safe place. So, seeing all these things, what I am trying to emphasize is a high time to think about the inner strength of this country. The inner strength of this country is its water, its river, its cows, its buffaloes, its farmers, its culture, its forests. So, see that what is the potential available with this, how to strengthen it, how to modernize it to some
extent without affecting the ecology. That kind of thing has to come. The COVID has given that chance. Otherwise, yes, it was a tsunami. It is something like anyone talks about local economy, localized, small, simple, beautiful. It was something like swimming against tsunami. Now it's a high time to think about understanding about the simple economy. That's why the whole world, despite many people talk about the development, but if you go through the sustainable development goals, the goal number 1, it's a no hunger. Yes, is it not a high time to take a pledge of every Indian, right? It may be the Prime Minister to the Chief Scientist to the ordinary man in the village or any corner of this country. Is it not the time to think in my country, everyone, no hunger, everyone is eating, everyone is getting at least after all a viable food. That kind of goal number 1, is it not possible to achieve it? Yes, it is possible. Then there is some leftover, there is some gap. How to fill it? What kind of technology for this? What kind of invention or innovation is needed for that? Work for this? Then no hunger, then less the poverty, lesser poverty, reducing the poverty. Then education for all. Everyone talks about education to fly. I know Dr. Vishwanathan and all the people. Yes, the education is gearing up you. It's a simple example I am telling. A 10th standard boy, before 9th standard, even 8th standard, 9th standard, 10th standard boy, the confidence he had and he is having in his own family, with his cow, with his buffalo, with his groundnut, with his banana tree, with his pond in the village. With that, the life was so confident for him. He goes to school, comes back to the school, comes back from the school, go and do some of the work, helping the father, helping the mother. That is the life. But unfortunately, slowly, when he passes 10th standard, when he comes to 11th standard and 12th standard, and he is going away from this. He is going away from this, learning something. With this, he is building confidence. No, the moment he passes his first year engineering, second year engineering, third year engineering, fourth year engineering, this fellow become a coward. In fact, he is not coming back to the village. Whenever he comes, the community itself is giving, oh, you are an engineer, don't come here. That kind of thing. And once you become an engineer, you will get your life, you will get your sustenance whenever, unless otherwise you get a job. There is no confidence for you. That's why we have to build the confidence. The confidence will be there. If Ilango, like, take me an example. I was an engineer, I became an engineer, a brilliant engineer, a scientist here and there, but I never lost the connection with my community. That's why I came back to the community, work with the community. Imagine how beautifully the science is invested in the village, in the community. Even in this COVID, just myself and the community, we work together and we have developed the first solar operated electrochlorinator, and it started 50 liters to 210 liters today, 100% solar operated. The solar energy is absorbed, kept in the battery. We have developed a small, gate times current regulator from 12 volt. Then it is regulated to 5 volt. 60 amps, 120 amps, it is passed to the sodium chloride. Now, sodium hypochlorite is coming in. So, just on 830, people are drawing 200 liters of 1% to 1.5% sodium hypochlorite, which is a disinfector. Then the women are taking it and they are adding something and they make a toilet cleaner for romance, alternate for Lysol. So this is what is sustainability. If it's the chemical side, like that, plenty of opportunities are available that in appropriately mixing the technology with the community. That's why in the community, we should have the faith in the system so that the technology can be well managed and appropriated and it could be invested with the community. That's why what I am trying is appropriation of technology. Otherwise, people get knocked out of 130 crore population. Even 80 crore people, you become graduates, you become engineers, you become MBAs. What will happen? People, the 30 or 25 crore people who are left over in the villages, they are the people really keeping us to stand. So that's why that the focus should be changing on sustainability. It should be simple and talks about the rivers are rock. No sand is there. Who has eaten the sand? Who made us to build concrete junks? Now there are no rivers are not having sand. It's a desert. So rivers are gone. Now somebody has excavated or invented the quick, what is that? Some sand. You are crushing the mountains. You are crushing the hills and making it a black sand or young sand. Again, you are so rivers are gone. In 10 years time, 25 years time, 30 years time, the rivers can be rejuvenated. Sand will come. It will accumulate. The aquifer may happen in 30 years time, 100 years time. If you are demolishing, crushing and eating away all the mountains, what will happen? Will you regenerate a mountain? Will you generate a Tirthani hill? So it is impossible. That's why in the aggressive talking of technology and money, dollar and all, at least COVID has given us the chance to rethink, and we have to think on that. That's why I am a small man. People are talking, and I'm a very small man. What I want is the Prime Minister has talked about self-sustenance. Self-sustenance of India. Is it possible? Anyone can challenge it is possible, but we can say it is possible to create a self-sustaining family, self-sustaining individuals, 4 or 5 individuals, the father, mother, the younger boy, the grandfather, a family. We can work on self-sustaining. Some land over. Backyard, you this. Akka, in your backyard, you do tomato. In your backyard, you grow chicken, you grow banana. Then automatically a self-sustaining community is possible. Self-sustaining communities, self-reliant villages, self-reliant even urban. The urban people, you are becoming self-reliant. You are able to generate something, some well, and here the rural people, the so-called agri-based people, they got something. Then there must be exchange. This is called the bargaining power of the people. Improve the bargaining power of the people by promoting more and more self-reliance. This is not at all happening in the grassroots. Self-reliant India. How many valves you buy, how many TVs you buy, how many things you buy, that will not be self-reliant. Self-reliant should start from the individual. That is what the model. You can see Kerala. Go there. There's no talk like this. Go to Kerala, travel across Kerala. Nobody talks like this. And they talk about their village. There is a panchayat. There's a committee for sustenance, committee for green, committee for water, committee for solid waste management. And that 25,000 population to manage everything. There is no burden for the chief minister. Just to give some advice or listen to the people. That is the beauty of the democracy. That is the awareness of the people. That's why go to Kerala. I'm not talking about there's a court or anything. Like the flood and other thing happened. And they never cried. They cried. They made a noise. But nobody came forward to support. But community came forward. Families came forward. That is the strength of the country. The strength of the state. The whole world has to learn from Kerala, your neighbor. So that's why I am very humble to talk. This is the time the God has given, or some kind of the nature. In fact, in a cycle of history, 100 years, 100 something. Some kind of calamity happens that makes us to think and rethink. So my humble request is think inner. What is the strength of us? How to revitalize the community? We need not even fly for some more time. You are not flown for this 50 days. Nobody bothered. But if the tomato has not grown, you would have gone. The onion has not grown, you would have gone. The rice is not available. You would have gone. So that's why you've got enough people, plenty of people. Let all the boys go back to the villages, go to those villages, go to those states, make a regional plan, make a village-wise plan, make a family-wise plan. Count should start from the family. There is an enormous possibility of for that, provided the educated sector joins for that. You get educated, work for a big company, create a big company, suck my water, make a reverse desert, make villages desert, then with that, what is going to happen? So I'm humble. I'm really thankful for this opportunity. Unfortunately, the screen is not working or it is not. It's again a rural urban divide or anything. But I'm happy at last now I'm able to make my noise. Here is a high time to think about the inner strength. If we are stood 40% of our concentration should be focused on re-establishing the farming, re-establishing the agriculture in a very scientific manner, and so that even if any some more worst thing happens next 6 months, next 1 year, it will be there. Humble life will be there. And you can manage other technology, other give and take, rupee, dollar, all these things you can manage, provided the bottom of the pyramid is very strong. And that's why the strength, and this is not a new thing I'm talking, it's a truth. This is what Gandhi talked. That's why Indianness, I want to emphasize, finish. This is called Indianness. Only the Indians can listen this. Yes. Everybody is talking, telling, but we have to put it to work. That's why with for our Professor Dr. Viswanathan and all the people who talk, and India needs young people, like young, have a bright knowledge, come back and make it appropriate about this. You are facilitating the people, capitalizing the people, capacitizing the community. That is the need of the hour. And I feel another 5 years I want to plunge in and work with this kind of people and see that the boys who are going back, people who are going back to the villages in the Bihar and all, I'm creating I've got a massive network of this thing, and with the chief minister and all, see that they are going to revive the villages, they are going to revive the agriculture, they are going to revive the security. So this is the area we have to work, and with this thanks for me.
Yes, sir. Thank you so much, sir. I think it's like a blasting session, we can say. Definitely, I think rural development, it's Ramachandran includes you. Definitely, I think people who are working in the ground level, as Kalam sir said, that will be like a real executions and real the needs of our country will be there, more than like other like people. Thank you so much for this inspiring talk. Definitely, I think the Kalam sir dream, the Pura and the model village of Putambakam. So we need to multiply it, and even I think from the House of Kalam, from Rameswaram, we can even initiate and we can go to the entire world. The Dreams of Kalam is coming up with all your support and guidance, and thank you so much. Without even like this video session, the audio was so vibrant, and thanks for coming for the session and making this a wonderful one. India Beyond Vision 2020, what's going to happen? Thank you so much, sir. I have a session for this speaker on the rural development is Dr. Sethu Kumaran. He is the founder of Sethu Bhaskara Group of Institutions and Sethu Bhaskara Agricultural College and Research Foundation. He is an ardent admirer of Dr. APJ Abdul Kalam. His adorations for his personality has enhanced tremendously after his meeting with his people's president in the Rashtrapati Bhavan at 2004. So, in the opinion of Bharat Ratna Dr. APJ Abdul Kalam, agriculture has a key role in reducing poverty, which he said in New Delhi on 9th October 2014. Yes. Who is also very close associate with our foundation and doing lots of work. And thank you so much for joining for the session, sir. So, over to you. Please start up the session, sir.
Very much. I'm proud of you
Today I really enjoy more than 4.5 hours, more than 5 hours. I think I maybe when you travel to Chennai to Seoul, you can reach that much of hour I spend at sea discuss about agriculture. I am so happy. Thanks to Kalam, Salim, everybody. Thank you very much. 5 years back, we purchased 240 acres land, and I put it. The name is called Kalam Rameswaram. BSc Agriculture student and Palestine. My guru, Kalamaya, at least Taiwan language, golden pages. The connection, you are told to visit your village side. People came from Chennai. One village, more people are involved in agriculture. Children also doing the kitchen gardens, asking many questions. I told them today is the last day because summer started. Sewing also okay now. Then after finishing the milk, the village people, all ladies came to my home. They put things to the animals. I shocked. So really I shocked. So why not we continue the milk process? He returned back lot of things. Kalamaya gave the happiness to the children, giving the tree plantation and everything. I'm really very happy. So kindly visit Agri College. Like that, we are doing something. The seaside also working with agriculture. We need all your support. So we need collective ideas. One of my friends is having a farm in Kenya, 6,000 acres. He's collecting the flower. And his head office in Dubai, only for rose. All of a sudden, they are suffering a lot. Even though Dr. Abdul Kalam philosophy and ideas, we are motivating them. Some words, words, we are sending the business people. This much of encourage we have to give. Today also, a lot of leaders, a lot of scientists, a lot of educationists talk about the agri. I was so happy. I thank all the people. My heartfelt thanks to all the people. It's a nice meeting. Thank you very much. Anything, please call me, or if you are interested, kindly visit Visala Engotai, Kalam Rameswaram. Thank you, sir.
Thank you so much, sir. I think.
Thank you, sir. You actually, as you said, when we started around 3 o'clock, 2:45, from that time onwards, you are still there, and that shows that your sincere attitude that you want to know from other leaders how they are, what is their opinion, and what is their ideas about the country. Thank you so much for being with us, sir. And we are privileged.
Yes, sir. I think rural sector has given a lots of value added for our session. Definitely, I think the Kalam sir's dream, as well as the Honorable Prime Minister also saying unfortunately the agriculture sector is going to improve a lot. So that's what we have seen in this COVID-19 also. Also the rural people. So as he said, I think a small gratitude we give them, they get lots of happiness among. So that's we are missing of. Definitely, this COVID has given a lot of rethinking happen, and definitely this Vision 2020 is going to be a success mode as we have taken this initiative today. Is there any query for us there for our panelists of rural development? From our panelist who's being in this room.
Actually, there are a lot of questions in rural development. I think we need to take it offline.
I have got one question.
Yes, sir. Please go.
Yeah. 36 years ago, I had been to Rameswaram and Pamban. There's one marine algal research station. Does that station still exist?
See, there is a marine biology center is in Mandapam. I think you are talking about that, right?
Yeah. Then it was marine algal research station.
Yeah, that's right. Yeah, still there. It exists.
It is still there.
Yeah.
So that is what development through these 4 decades.
See, it's all control. This is all regulated government work, right? So traditional way of doing things. So, so I'm not saying anything, any innovation happened in the recent past.
Okay. Extraction of iodine.
There are works still happening. But not exponentially. You would call it as a growth.
Still, it is working there. Okay.
Yeah, it's a regular office.
I hope in the near future I'll go there once again and maybe meeting you also. Yeah.
You are welcome.
Yes. Yeah.
Thank you, sir.
Thank you, sir. I think
it was a wonderful 5 hours. Wonderful 5 hours. Thank you.
Thank you so much. Okay, is there the panelists, anybody wanted having any query among all the session? I think we had completed 5 panel discussions.
We have Viswanathan sir still on. Sir, you have any question?
Yeah, Viswanathan sir is there, Ramadhan sir is there.
Former Vice Chancellor of University. Yeah. Sir, you have any questions, sir?
No, there's no question, there's only concern.
Yeah.
How to achieve our goal.
Yeah. Leader like you, we understand that. Leader like you, professors like you always have that concern.
Yeah, we have seen mostly the students, parents are spending 5 to 6 lakhs rupees, and finally the student is not getting any job on the road, and they are going to the extreme decision of suicide.
So, we understand that. So, from our, you were also there, foundation perspective, actually we started working with colleges, doing the skill building activity exercises. And in a small way, we are actually talking to a couple of companies and asking them what is that skill you need. And the same way we are communicating back to the colleges that what they should be doing it in a small way. But definitely we'll come to you and we'll ask your suggestions.
Yes.
Probably we can go together and talk to these colleges and we can convince them what they should be doing it. They are ready to listen to us. We show some research, assuming that if we take 15 students, we train them and put them on a job, and they start believe. So that is what we should be doing. And thank you so much for your time. So much time you have spent.
Always you call us. Yes. We are ready to follow the footpaths of Kalam. So you let us know when to do what.
Yeah. Thank you, sir. I think, other than panelists, we have few special invitees. I think if at all they want to give any feedback for a minute, they can also open up for the complete session. So that our session and
we welcome feedback. So we want to take the feedback.
I think Srinivas sir is there, and we have certain people.
Sasi sir, you can also see your feedback.
No, if I can say so, I think, first and foremost, the timing was absolutely right, wherein everybody is thinking that we have to do something better and new. And it is like reinforcing ourselves. I think this COVID-19 has basically helped us to reinforce our thoughts and, the vision. So that's number one. And second thing is, I think technology can bring all people together. If you have to get so many people to one place, imagine, would that be possible at all in a short notice? We all have restrictions, in physical movement. But technology has enabled all of us to be in the same room. I mean, today I get a feeling that all of us are sitting in the same room. Though we are kind of physically distant, but we are not socially distant. We are socially connected, but physically distant. So in henceforth, I think, we should use such technologies to kind of, improvise, connect, share, grow. I mean, it was so amazing to listen to each and every one of them. I mean, each and every one was so unique with what they have done and thoughts. So hats off to Kalam Foundation for organizing this, and also hats off to Gokul for being the he's now become the web jockey.
Yeah, he likes that. He likes that, and he voluntarily took that.
Thank you again. I think as Professor Vishwanathan mentioned, it's all about more what to do next. So that's why I always think of one thing, and if I can take this closer here. So this is what Dr. Kalam said. Right? Always focus on your goal. So let's continue to focus on our goals. And his goal is to have a vibrant India. It cannot be made in one day. I mean, it takes generations to do that. And I think we are in the right track and right direction at least. So that's all I would like to say first.
Thank you. Gogolji, you have somebody special invite you want to speak?
Yeah, we have a few people who are there, so they can give the feedback.
Yeah.
Am I audible?
Yes, we are audible. Please,
Right. Good evening, all. Thank you, Gokulji, for a wonderful opportunity. Kalam Foundation has done a good job. Well, all I wish to tell you was we have wonderful discussions. India has wonderful people. India has always had wonderful resources. The mind capacity of the Indians has already been proven all over the world. But where we have miserably failed is the action front. And there are hundreds of reasons why we have failed since the 1947. And most of the reasons are known to you all. So now let us get into the quickest form of action and see that the time that is lost is well compensated. And India's position as a premier country in the whole world should get established as fast as we can. But primarily, this is a symbol of a mere governments alone. Why? Because for a family of 5, a father is not able to take full care of. So therefore, expecting a couple of leaders to take care of 130 crore population is not a small matter. So therefore, let us all get together in the right spirit. And one strong point that I would like to tell you all is that I am very seriously working on a global online learning platform. And if any of you is interested in that, let us get together. And I feel that from this platform, most of the dreams that we are talking about can be very easily achieved. And that is the point I wanted to share with you all. Thanks for this wonderful opportunity. Thank you all.
Thank you so much, So, yeah, I think anybody else is there want to give the feedback or how to take up the next level? Maybe Ramachandran sir.
Next level would be, of course, today we have taken a very holistic view. Next sessions will be maybe subject wise. You know, agriculture you can take separate, aquaculture you can take separate, and education separate. Many things. It is primarily networking of brains. Networking of brains. If networking of brains comes, everything will be easy. I think we are not dearth of any knowledge and wisdom. We have wisdom, we have energy. We have energy like Sasikumar. We have wisdom like Y.S. Rajan. So in that perspective, I believe this exercise from House of Kalam must be taken on a regular interval. Maybe problem and solution based. Persons like Ilango, he was firing like anything. See, this is what I was telling, the passion, the belly by a fire, everybody should have. Whether it be a teacher or a farmer or anybody. That is possible only this kind of platform, I believe. I think as Professor Viswanathan said, we, the educationists and maybe technologists, we are with you. And anything, anywhere, any form, we are ready to support. And our salutation to our the family. That's all. Anything, we are with you, sir. Thank you very much. Gogul and you did a wonderful job. It's a span of hardly 24 hours. This is really made it possible. I think that is the gimmick of Dr. Kalam. If you take the name of the Kalam, everything is possible under this world. That's all. Thank you very much.
Yes, sir.
So before we close, behind the scene, whatever we are seeing, we are corrected.
Yes.
And wholeheartedly we want to thank our engineer, Balamurugan. And can you show your face, Balamurugan, sir?
Yeah.
So very patiently.
Balamurugan is an he is the AD of DNA.
So this is online conference, so we want a co-host manage this, because if you don't have a co-host, and it will be very difficult. We have co-host in Chennai